Good afternoon, sir.
हाँ नमस्कार नमस्कार ना
Namaskar, sir. Namaskar. अभिजीत सर भी दिखे थे मुझे भी बीच में।
हाँ जी वो रहेंगे जी। और मैंने संजय साहब से रिक्वेस्ट किया है, वो अभी मेल कर रहे हैं हमको।
ओके।
तो जो मेल आईडी आपने दिया है उसमें हम शेयर कर देंगे। हाँ अवधेश जी नमस्कार।
सोनिका मैम।
Good afternoon, sir.
आशीष सर।
Good afternoon, sir. Welcome to the platform, sir.
Thank you so much.
आपके प्रोग्राम के फॉर्मेट की यहाँ दिल्ली में बहुत चर्चा है।
अच्छा, थैंक यू सर।
हमने अभी पहले में आई शुड एक्सेप्ट द फैक्ट दैट इन द लास्ट फ्यू मेनी मोर दिस काइंड ऑफ प्रोग्राम्स हमने इसे कभी भी मटेरियलाइज होते हुए नहीं देखा है। बहुत बढ़िया कॉन्सेप्ट आपका, फर्स्ट डे सेकंड डे बहुत बढ़िया।
थैंक यू सर।
जो 3 टॉक्स के बाद में जो आप कर रही हैं वहाँ पे बहुत बढ़िया।
थैंक यू सर। आई थिंक इंटरेस्ट आ रहा है, स्टूडेंट्स को भी, फैकल्टी को भी इंटरेस्ट आ रहा है, बिकॉज दे आर एबल,
सेंस ऑफ बिलोंगिंगनेस भी आता है कि भाई हम भी जुड़े हैं।
कोई भी चीज सर प्रेजेंट करनी है, उसके पीछे जितना हार्ड वर्क होता है।
नहीं बहुत ज्यादा।
देवना मैम, यू आर देयर?
नमस्ते सर। नमस्ते मैम।
नमस्कार। ये बड़ी यूनिक चीज है इस प्रोग्राम का।
हाँ वही तो हाँ बिल्कुल।
अदरवाइज इन सब के लिए अलग से एक प्रोग्राम करना पड़ता है।
नहीं, वो जो 1 मिनट का टॉक है या एक पोइट्री है या फिर आपका एक वो कोलाज जो बना रहे हैं या जो फैकल्टी मेंबर्स आके एक पोस्टर बना के जा रहे हैं, वो 1 घंटे का काम नहीं है। वो बहुत दिन लगता है। बहुत मेहनत है।
बहुत मेहनत लगती है।
वो हमें उसकी तारीफ करनी।
Exact 2 we will start, sir.
Sure.
Right? Moses ma'am had to travel to Ludhiana. Her daughter got selected in CMC Ludhiana.
So, congratulations.
Devna ma'am will be there to lead us in prayer today.
Okay, sure.
Right?
Very good.
A very warm welcome to all our dear participants and dignitaries. It is gratifying to see so many participants from across the country join us. Today is the final day of this 3-day training program. Before commencing the program, I would like to request Ms. Devna Jemimia to lead us in prayer.
As we start today's event by asking God's guidance, I would like to read from a passage from the Bible, Psalm 28, verses 7, 8, and 9. The Lord is my strength and my shield. In him my heart trusts, and I am helped. My heart exults, and with my song I give thanks to him. The Lord is the strength of his people. He is the saving refuge of his anointed. O save your people and bless your heritage. Be their shepherd and carry them forever. Let's join in prayer. Heavenly Father, we thank you for this beautiful day. We thank you that you have brought us to the 3rd day of this webinar. I pray that you would bless each and every participant and organizers of Nidm and Isabella Thoburn College. Lord, as we have learned so many new things and very needed information, help us to put all that we have learned in practice. Father, let us be good and responsible citizens of this country who are always willing to lend a helping hand to someone in need. Even now, we commit this entire event into your hands. You guide us and lead us. All this I ask in the matchless name of Jesus. Amen. Over to you.
Thank you, Ms. Devina, for invoking Lord's blessings on the deliberations to follow and each one of us present here. Due to COVID-19 pandemic, all trainings and seminars have had to be conducted online, though it has its own limitations, but has many advantages as well. We were able to bring forth an array of speakers from across the country, from academia and industry, and had participants joining us from far away, remote parts of India. To name a few, Dakshin Dinapur, West Bengal, Tiruchirappalli, Tamil Nadu, Das Nagar, Punjab, Puralia, West Bengal, and Ganderbal, Jammu and Kashmir. In addition, we had people from various known cities like Bangalore, Ahmedabad, Hyderabad, Vishakhapatnam, Cochin, and Delhi. A quick recap of what we learned yesterday. We learned about the impact of disasters on biodiversity, rich biodiversity of India, various threats to biodiversity, role of biodiversity in maintaining ecosystem, and some success stories of eco-DRR practices were shared. Then we touched upon chemical disasters and their risk reduction via various case studies. The HASCEM code used on emergency information panels, the NFPA Diamond, and the globally harmonized system of labeling and safety data sheets and lab safety protocols. Professor Sanjay Singh reiterated the importance of community capacity building. We learned about different types of fire extinguishers and their usage, first aid preparedness, and disaster management kits and contingency plans. Poster presentation included discussions on a wide array of topics ranging from environmental, economic, nutritional aspects of disasters and disaster risk reduction strategies of the same. Now I would like to request Ms. Silky from Nidm to please take over today's technical session. Over to you, Ms. Silky.
Thank you so much, ma'am, for initiating the program. And I now officially begin the technical session. For that, I now request our first speaker of today's session, Mr. Ashish Kumar Panda, sir, consultant and faculty member, NIDM. He is faculty at ECDRM Division of National Institute of Disaster Management, New Delhi. Sir is a Central Secretariat Service Officer with an MBA in Disaster Management. He is also pursuing PhD in Climate Change field. He has more than 6 years working experience in Disaster Management Division of MHA. Sir has joined as a faculty member in September 2019 and looking after the division Center for Forestry, Biodiversity and Animal Inclusive Disaster Risk Reduction section of ECDRM division. Sir will talk about psychosocial care issues and challenges. Sir, over to you for your presentation.
Okay, thank you, Shilpi. I would like to share my presentation. Shilpi, is it visible?
Yes, you may proceed.
Is it visible, please?
Yes, sir, it is visible. Please.
Okay, full screen now?
Yes, sir.
Okay, thank you. So, thank you, Isabella Thoburn College, for having me once again for this beginning of technical session of the third day. And the topic that I've been given is psychosocial care issues and challenges. So I begin with one beautiful quotation in this regard that you can see this very pitiable picture of somebody from Africa. It says that in fragile and conflict affected settings, these mental health issues are compounded by exposure to conflict and violence. So in the few coming slides, we are going to learn what are the psychosocial care issues and challenges and how we have to fill those gaps. So as far as India is concerned, I always say that this is a theater of disasters. In the last 3 days that the presentations we have gone through, we have come across many occasions when we have learned because of our geomorphic positions, then psychosocial and social and economic situations of our community and the government. This is a theater of disasters as far as in India is concerned. You talk about natural disasters. They have been in the 21st century quite frequently being visible. Their intensity has increased, their frequency has increased. Then what to talk about man-made disasters? It can be industrial, chemical, fire, nuclear, then riots, then refugees. We see transboundary people are coming inside India. Recently, we have had issues of Rohingya people coming to India from the Bangladesh, Myanmar side. Then internally disposed people. During this pandemic, you must have seen these migrant laborers who are coming from Maharashtra side to their parent states of Bihar, Chhattisgarh, Odisha, and West Bengal, and so on and so forth. So these are issues. Then prolonged conflicts, etc., with respect to use of natural resources and other issues. It retards the country's overall development, basically. So what happens? It brings lots of human agonies. We see loss of human life. We see our livelihood losses, then livestock losses. In the poor countries like India and the developing countries like India, most of the population in the rural sector, they are dependent on livestock hugely for their day-to-day living and earning. Then we see damage to properties. Then we see physical injuries also, fatalities also, human life fatalities. Then what we do? We need relief. We need rehabilitation. We care for physical health and injuries. And with the wherewithal of the government and the having the scarce resources that is available in a post-disaster situation, we try to provide relief and rehabilitation and care of physical health and injuries to the persons, the impacted community. In this process, this very important aspect of psychosocial and mental health issues, they have been left behind for the many decades, so to say. Very recently, past 2 decades, we are observing some evolution of this needed psychosocial and mental health issues that is equally important with respect to what physical relief and rehabilitation we provide to the impacted community in a post-disaster scenario. This slide you must have seen in the first day my talk. This talks about pre-disaster situation, then the heroic phase, this honeymoon phase when this due to community cohesion and everybody coming to help this impacted community. So they feel like in a situation of honeymoon. Then comes this graph goes down of disillusionment. This period can be from 3 days to 3 months to 3 years even. Then comes that coming to term phase where we work through grief. Then due to trigger events and anniversary reactions, we again go down emotionally. Then because we are human beings, we are very strong mentally, then we go for reconstruction and go for new beginning. So this total phase, it can last from 1 year to 2 years to say 15 to 20 years if we talk about the Bhopal gas tragedy kind of things like ma'am yesterday talked about. So remember this schematic diagram and this phases of disasters. This is required for the next slide to understand. Now, please see. The occurrence of disaster within hours it takes place, then the kind of feeling that goes inside ourselves with respect to psychosocial feelings. This is apathy, disorientation, then wandering, surprise, fear, perplexity, anxiety, helplessness, kind of feeling that we have. But during those heroic phases, this may last from 1 to 2 weeks, we start feeling strong, that savior kind of feeling. मुझ में वो ताकत है कि मैं इस community को मैं बचा सकता हूँ, और we do everything with the whatever scarce resources we have. Then heroism, solidarity, optimism, this kind of feelings are inside with us. This kinds of positive feelings, this also lasts in the honeymoon period, that is from 1 week to 2 weeks to 6 months even. Then that solidarity, eagerness to rebuild, to help each and everybody in this whole process, then experience sharing and things like that. These kinds of feelings will be there till this honeymoon phases. Now, our concern is this disillusionment phase. This may last from 2 months to 2 years to 3 years. Then we start having this feelings like withdrawal symptoms, loneliness, anger, frustration. These are very important emotions which need to be taken care of in a psychosocial care. Then community get disorganized, then all kinds of negativity. Some people start feeling that ये सारा जो कुछ हुआ है वो मेरे कारण हुआ है. So hostility between communities, then impulsiveness, because natural resources are very rare. So this hostility comes between them. Then violence we see. Then the youth population, especially, they go for alcohol and drug abuse in a post-disaster scenario. So we have to take care of those kinds of situations. In the reconstruction phase, that may last from 2 to 5 years to probably a lifetime in some of the cases. This acceptance of losses, this realistic assessment of the situation, that is very, very important, that needs to be imbibed, inculcated in the impacted population, and we have to go for search for alternatives to rebuild lives. So these are related to what kinds of emotions that go inside ourselves with respect to impact of disaster in a post-disaster scenario. Now we talk about psychosocial care and mental health services, then comprehensive interventions are required for this kind of activities in a post-disaster scenario. What they do, they address wide range of psychosocial problems. Basically, the target is to help the community to restore their social cohesion. जो बिखराव आ गया है समाज में disaster के कारण, या infrastructure losses जो हो चुके हैं, उन्हें कैसे rebuild किया जाए social care के द्वारा, maintain their independence और dignity जो वो lose कर चुके हैं, जो उनका mindset नीचे जा चुका है, उसे कैसे ऊपर लेके आना है. These kinds of activities are included in these kinds of services. It helps reduce level of actual and perceived stress. दो किस्म के stress होते हैं, एक तो impact हुआ, आप खुद प्रभावित हो, और जो actual stress you are feeling, that is actual, then perceived what may happen in future, how I am going to survive. If the earning member of the family has lost the life, then what is going to happen to the kids? These kinds of perceived stress that needs to be prevented, and we have to prevent the adverse psychological and social consequences with respect to these two kinds of stresses. We have to identify and treat stress-related psychological symptoms or mental disorders. If we don't treat these symptoms, they may turn into mental disorders for a longer duration. So we have to go for mental health promotion and prevention of psychological symptoms among disaster-affected population. That is our motive. Now, if we see disaster mental health, as I said, for the last 2 decades, we are observing this psychosocial care and mental health kinds of service included in the disaster impact services. It has evolved in the last 2 decades. So earlier, you must have seen the period of 1984, that famous Bhopal gas disaster. It was to the tune of mental disorder only. You have to go to the hospital. Then if I talk about Latur earthquake, symptoms where you have to go to the hospital, public health services for your mental health related issues. But later, after this 1919 Odisha super cyclone, this 2001 Bhuj earthquake, and later on Kashmir earthquake and tsunamis of 2004, the mindset of this policymakers is changed. Now they started clubbing together generic health services with the psychosocial and mental health care services. And basically, earlier it was purely clinical hospital-based planning and service delivery. The patients had to go to the hospital for service delivery, but later on the scenario changed to community-based services. Now the caregiver, the psychosocial caregiver, they go to the site where the disaster has impacted, and they work with the community. They utilize the community resources as well. So earlier you would be seeing on the ground only psychiatrists, but now you are seeing clinical psychologists, you are seeing psychiatric social workers also, professionals, para-professionals, trained community level workers, we call them CLWs, and also the people like motivated persons like us, like many of your college people would be going to this kind of programs if you are permitted to by your authorities. So they are called volunteers. So all these forces are required to take care of psychosocial care and mental health services. So if you remember that Maslow's principle of that basic management, what we need, physiological needs, if that is fulfilled, then we go for self-actualization, self-esteemed goals. Similarly, for this this intervention pyramid, if we talk about for mental health and psychosocial support in emergencies. So basically, in the beginning, what we do, we provide basic services and security to the impacted community. Then we go for community and family supports. Then focused but non-specialized supports are given. And in the end, when it turns into mental disorder kind of a situation, we provide a specialized kind of services in the process. So as a caregiver, as a psychosocial and mental health service provider, suppose I am that person, so what I have to identify in rehabilitation programs, we have to identify the needs of the survivor, attend to their specific problem. They have recently lost their family, home, and relief measures they require like anything. They have recently lost their source of livelihood. And if compensations are being given in a post-disaster scenario, probably they're not getting these compensations as well. So another stress, then difficulty in construction of their homes and blow in gratification of primary needs, comforts, then loss of social status and relations also. They might have lost some very near dear, very close family members also. They might be having security problems, specifically the women and elderly people and children in this camps and other places. They find security problems also. Then their feelings of powerlessness, helplessness, lack of adjustment. Then also occupational redundancy is observed in these impacted community. So we have to address their loneliness, their low self-esteem, their negative attitude towards self, low level of self-efficacy, and also their future of reoccurrence of these kinds of disasters that is there inside them. We have to address their anxiety, their stress, hostility, and things like that. So basically, it has to be a proper coordinated approach to build up the holistic care model with respect to psychosocial care and mental health services. So this is a very common logic that no one who experiences or witnesses the event is untouched by it. If I'm impacted by a disaster, definitely I will be impacted in a mental fashion. But somebody is watching in the print electronic media, or reading the news in print media, even that person is affected by disasters mentally. So disaster, depending on their nature and magnitude, cause enormous loss of life, property, and environment. Everybody knows that. But this also brings grief, sadness, anxiety, anger, as common in such situations. And almost everybody is affected. So even people who have followed the event through the television, print media, as I said, they are also going to be affected by that. Some people may not on surface seem very distraught or affected. कई लोगों को देख के लगता है इनको तो कोई फर्क ही नहीं पड़ा. But given the space, if they are allowed space and allowed to talk, then they will share their experiences and feelings and about the event. और ये एक मिथ है कि जो वो कहते हैं कि मर्द को दर्द नहीं होता, या जो मेल्स होते हैं उन्हें रोने की जरूरत नहीं होती है, केवल औरतें रो सकती हैं. ऐसा कुछ भी नहीं है. बाहर से कोई व्यक्ति कितना भी स्ट्रांग दिखे, स्पेशली जो मैन है, उन्हें भी सपोर्ट की जरूरत है. वो भी मैनेज नहीं कर सकते विदाउट एक्सटर्नल सपोर्ट. सो ये डिपेंड करता है पर्सन टू पर्सन, बी इट ए मैन, बी इट ए वुमन, व्हाट काइंड ऑफ सपोर्ट, और डिग्री क्या होगी, उसका पीरियड का टाइम स्पैन क्या होगा. दिस मे वेरी. अदरवाइज ईच एंड एवरीबॉडी इज रिक्वायर्स द psychosocial care and mental health services in a post disaster scenario. So what happens, as an individual, I have got my intrinsic vulnerability with respect to what is going to happen in outside my this physical body. That vulnerability is always there. Put together the psychosocial stresses in a disaster event, दोनों को यदि आप क्लब कर दें, then comes this mental disorder kind of situation, mental illness kind of situation. So as a psychosocial caregiver, we have to be very, very particular about how to address these kinds of issues. So disaster stress and grief reactions are not, ये हमें उन्हें बार-बार बताने की जरूरत है कि देखिए, आप होते या मैं होता तो भी हमें ये सिचुएशन फॉलो कर मतलब फेस करने की जरूरत पड़ती. तो हमें उन्हें बताते रहना है. होता क्या है, camps में living in cramped living spaces with limited resources adds to stress of survivors. So this is an abnormal event. We have to tell the survivors that this can happen to each and everybody. So you are giving varied reactions because of your internal that vulnerability ratio. So these are perfectly normal situations, and most people would overcome these reactions if you are going to emotionally, we are going to give them right kind of psychosocial support and care in a post-disaster scenario. So we have to make survivors understand that this phase, ये phase भी जो लाइफ का है, वो पास हो जाएगा, वो चला जाएगा. इससे बहुत ज्यादा घबराने की जरूरत नहीं है, और आपको जो फीलिंग हो रही है वो बहुत एक नॉर्मल कॉमन फीलिंग है, ये बताने की जरूरत है. सो बेसिकली व्हाट वी डू, वी इनेबल इकोनॉमिक इंडिपेंडेंस. सबसे पहले क्या करने की जरूरत है, डोंट वरी अबाउट द साइकोसोशल केयर. फर्स्ट प्रोवाइड, सपोज देयर लाइवलीहुड हैज गॉन, वी हैव टू प्रोवाइड देम इकोनॉमिक इंडिपेंडेंस और सोशल पार्टिसिपेशन. जो प्लान एंड प्रोसेसेस दैट वी are going to build for their own upliftment, their own recovery and rehabilitation, we have to involve these people, impacted community. What we do thereafter, we secure existential needs, health, hygiene, nutrition, shelter. ये पहले देखेंगे. उसके बाद then we go for their stress management through relaxation, group activities और discussion. और इसके भी beyond coping capacity चला जाता है. So what we do, we provide them psychotherapy. We provide them, एक word बड़ा famous है इसमें कि PTSD, जिसे कहते हैं post traumatic stress disorder. So when it is identified that impacted community is facing the PTSD, then specific psychiatric people are there, experts are there, psychological doctors are there. They are going to treat this kind of persons through psychotherapy, and we have to understand this kind of needs. So disaster results in two types of trauma. पहला तो individual हुआ, जो individual को जो trauma मिलता है, फिर एक collective trauma होता है as a community cohesive way में. तो individual में stress and grief reactions होते हैं, उसको accordingly treat करने की जरूरत है. Then for collective trauma, this leads to deterioration of social ties of survivors among themselves, then social ties between families. So ये natural buffer होता है. हम social animal हैं, so जो family is our natural buffer with respect to our emotions, how to safeguard ourselves from going deep down with grief, anxiety, and fear factors and things like that. So first job of psychosocial caregiver is to restore these kinds of natural buffers. यदि family से वो अलग हो गए हैं तो पहले उनकी family को जोड़ने की जरूरत है. How we do that? We go for outreach programs. We utilize support groups, self-help groups of the affected community. उनका ही एक ग्रुप बना के हम ऐसे लोगों मिसिंग families को जोड़ने का काम कर सकते हैं. Then we also go for community rebuilding program. In large scale natural disaster जब होता है तो उसमें ये collective वाला जो impact है वो ज्यादा देखने को मिलता है बनिस्बत की individual impact. There is a scheme of this district mental health scheme, which is very, very important, which is running in our country right at this moment. Probably this needs to be strengthened. This needs to be tailored to meet the needs of the specific community to be served. Mental health and psychosocial intervention should be based on तीन तरीके से उसे जांच करने की जरूरत है उस schemes को according to the demography and the characteristic of the population. The demography of Northeast will be different from the demography of Maharashtra and way down south, the Tamil Nadu and this Kerala kind of states. Ethnic and cultural groups in the community of these places may vary with respect to their behavioral aspects in a post-disaster scenario. So accordingly, the plan and policy should change that way. Also, if I am from Delhi and if I am sent to Northeast place to go for the psychosocial care giver service, then I should be knowing that language. Otherwise, I am of no use. मैंने जितना भी ज्ञान इस साइंस में अर्जित किया है, that is of no use if I don't know the local language. So accordingly, the person needs to be trained first thing with respect to demographical issues and ethnic and cultural group issues. Also, the person should be knowing the local language of the affected community. Now, varied emotional reactions they change with respect to the phases. The initial phases में हम उनको listening से, supporting से, ventilation से, catharsis माने आप उन्हें रोने दीजिए जितना वो अपना grief को बाहर लाने की कोशिश करते हैं, उन्हें करने दीजिए. ये probably this helps the affected community in the initial phase itself. But on the later phase, we have to handle their frustration, their anger with respect to their loss of human life, with respect to loss of infrastructure, with respect to loss of livelihood. और disillusionment जो हो रहा है future को लेके वो important हो जाता है, उसको कैसे treat करना है. So this psychosocial and mental health care providers should know the phase specific needs. आपके जो plan policies केवल बना देने से नहीं होगा, phase wise, short term, long term, वो कैसे करना है, phase wise need assessment has to be done and accordingly those kinds of services has to be provided. Now, family is the most important support group, as I just now said. So we have to make effort to keep the family together. That gelling should be there, and members should be encouraged in getting involved in each other's recovery. Out of box thinking is very important. I gave one example of Mamata Grih post Odisha super cyclone, where this concept was brought for orphan children which were impacted by the Odisha super cyclone in 1999, and it has worked like anything. So this kind of out of box thinking can be thought of to provide psychosocial care to the impacted community. Now, what should be our attitude if we go to if we are sent to the site as a caregiver? I should approach this affected community with warmth, with genuine interest. उन्हें लगना चाहिए कि मैं उनकी बात सुनने के लिए आया हूँ. Also, they should be having confidence in me कि I am going to protect their privacy with respect to whatever they are going to share with me. So we need to try to break deep-rooted culturally prevailing myths and misconceptions. And ये करना कैसे है कि aim to curb these myths appropriately without hurting their emotions of the survivors. So we have to avoid mental health labels like जब उनसे बात करें तो ऐसे terms use नहीं करना, neurotic, counseling, psychotic, psychotherapy, क्योंकि एक अनपढ़ भी आज के जमाने में इन terms को जानता है. तो ये social stigma से related है. It means if we use these kinds of terms, then before beginning the therapy, before beginning the kinds of services we are going to provide to this impacted community, we are labeling them as a sick person. So probably they are not going to reach you for the services they need. So active community outreach approach is very, very important to intervene successfully in disaster situations. Now, psychological distress could be very high among the children. देखिए अलग-अलग disadvantaged groups हो सकते हैं community में. Children हो सकते हैं, women हो सकते हैं, elderly persons हो सकते हैं, disabled persons हो सकते हैं, और कुछ तो ऐसे हो सकते हैं जो already mental illness झेल रहे हो. Then there are persons who are already facing critical health issues. So those disadvantaged groups have to be treated differently with respect to psychosocial care and mental health services. They are more prone to adverse these consequences of disasters due to many reasons. We have to provide them special attentions, और उनको service provide वही करेगा जो भी trained होगा उस field में. We have to try to encompass their specific needs in the times of a post-disaster scenario and their specific requirements with respect to relief, with respect to health services, with respect to rehabilitation and restoration of their dignity, सो उसको पूरा एक पैकेज के रूप में उन्हें कैसे प्रोवाइड कर सकते हैं, इसकी ट्रेनिंग होनी चाहिए और ऐसे लोगों को ही डिसएडवांटेज ग्रुप के पास भेजना चाहिए. नाउ वी टॉक अबाउट सम स्पेसिफिक डिसएडवांटेज ग्रुप्स, women, because of their differential biological makeup, because of already in a pre-disaster scenario, because of the economic, social, psychological challenges and cultural disadvantages women are facing in the normal society. So when disaster comes, they face greater emotional distress during the times of disaster. So their loss, जो loss उनको family loss हुआ है, infrastructure loss हुआ है, their emotional reactions, their needs, this has to be met by these caregivers. Basic amenities and securities, relief camps में उनको जो मिलनी चाहिए, if they want any kinds of legal help and other aspects of the spectrum of whatever care that has to be provided to women, specifically targeting their needs, that needs to be provided to them. And then this impacted women community, if they want to be party to the plan and policies that we are going to prepare in a post-disaster scenario, then they should be welcome, because the kinds of experiences they bring to the table, the platform, that is very, very important. If you are going to make a plan for women, then they have to be there. They have to be more than 50% in the planning processes. And then under this disadvantaged group of women, there are another subcategories of more disadvantaged section of women, like pregnant and lactating women, disabled women, women on critical healthcare facility, women who have lost their children and they're planning to undergo recanalization surgery, elderly women, and women with prior history of psychiatric illnesses. So specific kinds of their needs are there, and accordingly they need to be helped. Now we talk about children. Now, as per their age groups and their socio-economic background, they behave differently with respect to the stress situations. It can be developmental age, it can be sex, male and female, they can behave differently in different situations, physical status, social and emotional maturity, and the nature of loss. किसी के घर में family loss हुआ होगा, किसी के घर में नहीं हुआ होगा. So accordingly, differently they behave. So we have to provide that kind of facility to them. Some of the children might have seen the death of a near dear one recently, loss of friends and relatives they must have watched, loss of property, familiar places, lots of pets also. कुछ बच्चों को जानवरों से बहुत लगाव होता है, उस जानवर का हो सकता है देहांत हो गया हो. और कुछ को तो मेडिकल फैसिलिटीज की जरूरत होती है, तो ऐसे केसेस में उनको आइडेंटिफाई करके अलग किस्म का, सिमिलरली लाइक वी saw in the women section, in children section, this disadvantaged group, there are specific children group which need greater attention. It can be orphaned and unaccompanied children, especially girls. Then it can be children whose parents are missing, children whose parents have remarried, children who have been disabled or injured, children who are physically or mentally challenged. Then there are children who are dependent on critical healthcare facilities. कुछ को जैसे ये hematological blood disorder में उनको weekly blood transfusion की जरूरत पड़ती है. So in a disaster situation, we have to identify these kind of children and accordingly we have to provide them care. Now people with disabilities. So one act of 1995 says that even in PWDs, it is a highly diverse group. Each disability has its unique characteristics and disability specific needs. So life is already for them at a higher deprivation level. Forget about the disaster. In a pre-disaster situation also, higher level of psychological distress and negative emotional reactions are already there inside them because of their physical inabilities. So we have to provide specific kind of treatment and attention and care to this kind of community. So we have to, the intervention to address their overall safety, dignity, needs are required with more emphasis on the intersectoral collaborations for their betterment, or we need to probably provide special attention to the accessibility to shelters, availability of basic amenities, availability of auxiliary aids. Specific ये photograph यदि आप देख रहे हैं तो यदि इनका ये auxiliary aid यदि इनसे चला जाए तो we need to provide these kinds of aids to these kinds of community. Then they may be needing special livelihood programs, treatment for any associated to psychiatric illness. Long-term community rehabilitation is also important for PWDs. Then elderly persons, because of their reduced physical capabilities, reduced mental capabilities, even in a pre-disaster situation, delayed response syndrome, increased transfer trauma, and the area of emotional difficulties, and many psychosocial problems with respect to the elderly people. It gets compounded in case of disaster and often in widely varied circumstances. So basic health facility is the priority for these kind of persons. We have to provide these to them, and most often they are neglected with respect to providing these kinds of services. And therefore, I urge that we have to watch. At least हम अपने घर में तो कर सकते हैं. Charity begins at home, so we should provide them specific attention. While they need strong and persistent verbal factual reassurances, this reassurance has to be regular. एक बार बोल देने से काम नहीं चलेगा, बार बार उन्हें जताने की जरूरत है कि हम उन्हें प्यार करते हैं और हम उनके सुरक्षा के लिए हमेशा मौजूद हैं. Also, any short term or long term rehabiltating program की यदि जरूरत है उनको, तो वो प्रोवाइड करने की जरूरत है. Psychosocial care intervention should be designed to cater to their individual and specific needs as far as elderly persons are concerned. Then there is a community which is already facing chronic mental illnesses or critical healthcare conditions. So there should be continuity of this treatment even in a post-disaster scenario. So district mental health program or other available mental health services should be tailored in such a fashion that these extra needs of these specific sub-part of our community, our society, that is met. So this can be people on dialysis already. This can be people with organ transplantation. Somebody must have gone recently heart surgeries. Then there are alcohol, drug abuse dependent persons. Then people living with HIV/AIDS. Then people on specific therapies like cancers and other chronic diseases. Then there are persons who regularly need insulin because of their diabetes kind of situation. So we have to take care of these kinds of specific communities. Now, having drawn this kind of a picture, now I would like to tell about what are those issues, what are those challenges, where we have all those kinds of resources to meet what is required to provide psychosocial care and mental health services to the affected community in a post-disaster scenario. So if we are in a position to find the gap areas, then only probably we will be in a position to provide some sustainable solution to these kinds of gap areas. So what are those gap areas? As far as planning and coordination is concerned, what we observe, there is complete lack of planning with respect to preparedness, with respect to capacity building, as far as the psychosocial care services and mental health services are concerned. If at all planning is being done in these sectors, that is being in a single vertical. They are working in silos. So it should be integrated and intersectoral for immediate and long-term goals. Now, medical health professional should be, उनका काम सिर्फ ये नहीं है कि उनको साइट में भेज के उनसे सर्विसेज लेना है. They should be actively involved in the planning process of these kinds of services. And these kinds of services, if you imagine or remember, this is always considered as a time-bound activity. 1 महीने के लिए भेज दीजिए, 2 महीने के लिए भेज दीजिए, 3-4 महीने के लिए भेज दीजिए, हमारा काम खत्म. ऐसा नहीं है. Rather, it should be timeline activity. It can last 3 to 5 years, and probably in Bhopal gas tragedy kind of a situation, it can last more than 10 to 15 years. Psychosocial care and mental health services will be required to be given to the impacted community. So real need for reconciliation goes along with long-term rehabilitation as far as these kinds of services are concerned. So this is very important aspect. The policymakers and implementers on the ground, they should remember. But 2 more important aspects are, वैसे ही ग्राउंड लेवल पे साइकोसोशल केयर प्रोवाइड करने वाले लोगों की एजेंसीज की संख्या कम है. उनके बीच में जो इंट्रा एजेंसी कोऑर्डिनेशन होता है, that is many times seems lacking, and also the inter coordination of these services with other relief agencies. जो generic relief agencies जो गवर्नमेंट की प्रोवाइड की जाती है, other than psychosocial care, उनके बीच में भी जो coordination, जो gelling होना चाहिए, जो synergy होना चाहिए, that is always missing. So this is one area where we can work. Now, proper implementation of these kinds of services requires comprehensive risk and vulnerability assessment. ये assessment पहले से होना चाहिए कि किस जगह की कम्युनिटी के लिए किस किस्म की सर्विसेज की जरूरत है, और उस अकॉर्डिंगली वो सर्विसेज फिर प्रोवाइड करनी चाहिए. इफ यू टॉक अबाउट द इनिशियल फेज, हम क्या करते हैं, वी प्रोवाइड टू मच. किसी भी डिजास्टर में फॉरगेट अबाउट साइकोसोशल केयर और मेंटल हेल्थ सर्विसेज, जेनेरिक रिलीफ भी जो होता है, आप देखेंगे कहीं कोई डिजास्टर आता है तो वी प्रोवाइड टू मच ऑफ हेल्प इन द वेरी बिगिनिंग. देन व्हाट हैपेंस, देन क्विक वीनिंग फेज कम्स. ये धीरे धीरे सर्विस प्रोवाइडर्स, केयर गिवर से गायब होने लगते हैं. So appropriately designed phase-wise response has to be given. Then there is acute shortage of skilled service provider as far as these services are concerned. Even the professionals who are working on the ground, probably the kinds of studies they have gone through, जो उन्होंने MBBS किया है, जो पोस्ट डॉक्टरल जो उन्होंने पढ़ाई की हुई है, वो रियल टाइम सिचुएशन, वैसे भी कोई डिजास्टर जो होता है पुराने किसी डिजास्टर से मेल खाता हुआ नहीं आता है. वो अलग किस्म का एक डिजास्टर होता है. हर डिजास्टर एक नया लेसन हमें सिखाता है. तभी तो हमारे ऑनरेबल प्राइम मिनिस्टर कहते हैं in his famous 10-point agenda for DRM, that we should not leave any opportunity to learn from any disaster in a country like India. So even the professionals who are working on the ground level, they lack adequate training. So एक तो scarcity है उनके skilled service provider की संख्या में, और जो है उनके पास भी adequate training नहीं है. So probably this is one area where the government needs to think about. Now that famous district mental health program, this is adequate only to meet the generic health services. It is not tailored to provide the mental health services or the psychosocial care kind of things. So this has to be strengthened in that capacity. Then only the local population of the rural or this block level or small district level population, they are not going to bombard into the tier 1 kinds of cities. So we have to strengthen the local health services. That is very, very important with respect to psychosocial care and mental health services. Now, do we have standardized tools like manuals, indicators to get the information from the ground level, then synthesize this information, then accordingly change our plans and policies with respect to the requirements of the affected community? No, we don't have. So these services for immediate interventions, that is there. But for long-term relief and rehabilitation, we don't have any plan. Then आपने देखा होगा कि साइट्स पे आपको बेसिकली प्राइवेट एजेंसीज ज्यादा दिखेंगे साइकोसोशल केयर और मेंटल हेल्थ सर्विसेज प्रोवाइड करती हुई. तो वो कौन सी हुई? वो डोनर एजेंसी हुई. तो उनका क्या है? उनका भी अपना एक आउटलुक है, उन्हें भी अपनी तारीफ करवानी है, उन्हें भी अपना एक एजेंडा होता है. सो ये डोनर एजेंसी अप्रोच हो जाता है दिस काइंड्स ऑफ सर्विसेज में. दे इन मेनी ऑफ द केसेस दे डिसरिगार्ड द प्रायोरिटीज एंड नीड्स ऑफ द कम्युनिटी. दे लुक आफ्टर ओनली देयर वेस्टेड इंटरेस्ट्स. सो दिस इज वन एरिया वेयर द गवर्नमेंट should come forward and give the right kind of solution with respect to that. Then inadequate knowledge of cultural beliefs of that local community, of local area, then practices and community priorities. This is very, very important. The caregivers and these organizations who are providing these kinds of services, they have to collaborate with local authorities. They don't do that. So this affects the long-term sustainability and long-term interventions. Now it lacks a permanent public-private partnerships model also. Just now I said that on the site, what you are observing are the private persons many a times. So there should be a collaboration and coordination between the government models and the private models, so that a right kind of approach can be adopted and the needs of the local community is catered to. So we have to integrate and coordinate various activities in such a fashion that we avoid duplicity. Duplicity नहीं होगी. Scarce resources होते हैं तो duplicity में और loss हो जाता है. So we have to ensure appropriate delivery of services. So it should include all hazards. वो hazard बड़ा हो छोटा हो, disaster बड़ा हो छोटा हो, all the population that is affected by conflict situations. ये internally migrated हो सकते हैं, ये displaced community हो सकते हैं, जैसे अभी पैंडेमिक में हमने माइग्रेंट वर्कर्स का देखा. ऑल्सो डिजास्टर्स ऑफ लो इंटेंसिटी, छोटा डिजास्टर भी हुआ है तो हमें जाके वॉच करने की जरूरत है वेदर दिस काइंड्स ऑफ सर्विसेज साइकोसोशल केयर मेंटल हेल्थ केयर इज रिक्वायर्ड और नॉट. सो इंस्टेड ऑफ मेडिकल मॉडल, जैसे पहले क्या होता था हॉस्पिटल ही भेज देना है पेशेंट को, हमें क्या करना चाहिए? वी हैव टू डिवाइस एंड फॉलो बायो साइकोसोशल मॉडल. और ये शिफ्ट स्टार्ट हो चुका है पोस्ट ओडिशा सुपर साइक्लोन एंड भुज अर्थक्वेक के समय से ये स्टार्ट हो चुका है. अब आप केवल साइकेट्रिक, जैसे मैंने पहले बताया, यू डोंट सी ओनली साइकेट्रिस्ट्स ऑन द ग्राउंड, यू सी मेनी काइंड्स ऑफ वॉलंटियर्स एंड साइकोलॉजिस्ट्स एंड केयर गिवर्स फ्रॉम डिफरेंट डिपार्टमेंट्स एंड डिफरेंट entities. So this is also required. So this shift has already started. We have to support this kind of shift with respect to modeling of what kind of services is required at the ground level. So a specific intervention model for substance abuse. Post disaster scenario में तो youth group जो होता है that goes for this drug abuse. So for those kinds of sub community, we have to bring in a specific intervention model so that their needs can be catered to. So now this mental health services should utilize local best practices and indigenous care systems also. We have to involve the local community as well, because impacted community के लिए उतने experts, उतने caregivers हर बार दे पाना मुश्किल होता है. So it is better to form self-help groups of the affected community. They are going to work with the experts and accordingly using the local best practices and indigenous care system. The kind of services that is required at the ground level that can be provided. Then we need to adopt and integrate well-tested and recognized methods. ये कहीं भी हुए हों उसको indigenously हमारे यहाँ पे कस्टमाइज करके इंडिया के कॉन्टेक्स्ट में या उस स्टेट के कॉन्टेक्स्ट में करके हमें ये सर्विस प्रोवाइड करने की स्कीम्स को बनाना चाहिए. Then this is very important. We have to maintain during this process while providing services, we have to maintain the dignity of the individual and the community, which has recently gone through too much. So we fail probably due to in this kind of services because of inadequate resources, pressure to respond within short periods, and lack of training. जैसे मुझे यदि साइट पे भेजा गया है, मेरी ड्यूटी यदि 4 घंटे की है, जैसा हम पेंडेमिक में देख रहे हैं, मुझे यदि 8 घंटे की ड्यूटी करनी पड़े तो मैं इरिटेट तो होऊंगा. Probably in that process I am failing to
सर आपको अनम्यूट करना पड़ेगा, शायद आप म्यूट हो गए हैं. हेलो
सर, काइंडली अनम्यूट योरसेल्फ प्लीज.
हाँ कर लिया. अभी आवाज आ रही मेरी?
यस सर, आ रही है.
Okay. Fine. So we should, we fail to provide the kind of dignity, to maintain the dignity of individual and community of the affected community. So we should be watchful and thoughtful with respect to our behavior to the affected community. So institutional mechanism for monitoring and evaluation, that is one lacking area of the progress made, that should be there. Protocol should be there. Accreditation of the programs by nodal institution should be there. Standardized indicators for different programs has to be there, so that many different kinds of agencies and stakeholders which are going to the site to get the information or to provide services to the affected community, it should be in unison. It should be uniform, so that scarce resources are utilized for the proper purpose and duplicity is not there. Now we have to create a comprehensive infrastructure enhancing knowledge, skills and abilities. Like मैंने कहा कि जो ground level पे जो experts जाते हैं, probably उन्हें भी वो skills provide करने की जरूरत है कि disaster specific skills they should be having, ताकि उनकी जो ability है as a caregiver that is enhanced like anything, and the affected community is benefited. So inadequate trained manpower, that is one area of concern. We have lack of database, we have lack of inventory. तो उससे loss क्या होता है? Either we are underutilizing the resources that is available with us, or we are not at all utilizing their services. नॉर्थ ईस्ट में यदि कोई प्रॉब्लम आता है, कोई डिजास्टर आता है और हमें साइकोसोशल केयर भेजने की जरूरत है, सपोज हमें पता ही नहीं है कि कलकत्ता में कोई बैठा हुआ है जिसे हम भेज सकते हैं, तो क्या फायदा? ऐसे डाटाबेस का क्या फायदा? सो मोस्ट एचआरडी इंटरवेंशंस, ह्यूमन रिसोर्स जो ट्रेनिंग्स होती हैं, कैपेसिटी बिल्डिंग की जो ट्रेनिंग्स होती हैं, दे फोकस ओनली फॉर शॉर्ट टर्म टारगेट्स. So they should be for long-term targets, and not only the health and medical fraternity needs training and skill development, but also the other persons who are involved in these kinds of services, like they can be from the Department of Education, from Department of Welfare, they can be community workers, or even the local volunteers. So before they are sent to the ground, they need to be trained accordingly. So inadequate capacity for big disaster, that is one very big area of concern as far as psychosocial care and mental health services are concerned. Then we lack a proper networking within the institutional framework. That is very, very important. And these services should be strongly recommended as far as district mental health programs are concerned. And this should be imbibed in the educational curriculum also. एक example हम दे सकते हैं कि MBBS courses में undergraduate level पे आप इस psychosocial care और mental health services की कुछ credit courses आप रख सकते हैं. And for the psychology and social work programs, at the master's level, you can bring in this subject. So there is need for more mental health service specialists, more training is required. Clinical psychologist हमें चाहिए, psychiatric हमें चाहिए, social worker हमें चाहिए, और इनकी time to time training भी होती रहनी चाहिए. Also documentation बहुत कम होता है in post disaster scenario में with respect to PSS, MHS. So वो जो कमी है उसे भी पूरा करने की कोशिश करनी चाहिए. Now another problem is complete absence of coordination. जो भी agencies that at local level or regional level they are working, that coordination is missing. So we can work in those directions. And it is always, I already said that it works in the silos, in the vertical, working differently, not in cohesion with other relief providing agencies. So the isolation has to be avoided, and integrity should be brought with respect to other agencies. and then only partially integrated as far as general health work. थोड़ा सा इंटीग्रेशन आपको दिखता है जनरल हेल्थ वर्क के साथ में, लेकिन जो अदर रिलीफ वर्क जो पोस्ट डिजास्टर सिनेरियो में दिया जाता है उसके साथ में तो उसका कोई लिंकेज दिखता नहीं है. Then we don't have any well-defined designated agency for these kinds of services. So since agency is not there, so there is no accountability. So we have to review and strengthen our primary health care centers, I said, in the block level, in the village level. यदि हम उन्हें strengthen कर दें with respect to these kinds of services, so probably the masses from this rural sector, they are not going to jump upon the services that is being provided in big cities. So research and development, that is one important area that is missing. So systematic tracking of every level of intervention and scientific analysis, that is very, very important. We have to identify shortcomings and improve service delivery. There is need for one body should be there. One identified body should be there, which is going to approve these kinds of R&D proposals, which is required in these areas. Then ethnic guidelines should be there, how these R&D activities will be done. Then documentation with respect to that. If at all documentation is being done, it comes very, very late. तो जो 4-5 साल के बाद यदि आप किसी डिजास्टर का डॉक्यूमेंटेशन करके देते हैं तो उसका रेलिवेंस खो जाता है, तो उसमें कोई इम्पोर्टेंट हमें तो नजर नहीं आता. Then trans-cultural issues, that is one area where R&D can be done. And then gender-based, vulnerable population-based specific tools and studies, that is missing in this area. And psychosocial care services or mental health care services, the difference between these two kinds of services and the impact studies, that is missing. ये बताए जाने की जरूरत है. Then few scholars are working at the doc level or post-doc level. So it also shows that the community which is going for higher studies in more and more scholars and whereas cultural issues are very, very relevant, so that needs to be built in as far as R&D is concerned. Then protective and risk factors, that is one area of concern where R&D can be done. Then factors for resilience of people in developing countries like India, that can be documented. Case studies can be done, and more students can be asked to do research in those areas, and that possibility of jobs in these areas should be enhanced so that the student community will be longing to come in this area. Then also the correlation between the severity of disaster and its psychological consequences, where R&D work can be done. Documentation is very, very important. We don't have probably proper format with respect to that. The persons we are sending to the ground level, they don't have the knowledge of what is to be collected and how it is to be synthesized. So that information, if at all they are having, how to manage those kinds of information, the data management. Having data is important, but how to manage those data, that is very, very important. So those kind of training and skill development is very important. So uniform structured guidelines should be there, and no accepted or documented framework to generate measurable and comparable outcome indicators, that is missing. So tangible benefits what the local community is getting. So if that can be accounted for, if that can be documented properly, so that would be beneficial with respect to these kinds of services for the future disasters to come. So और एक बात होती है कि when we go for documentation, we interview the local community, which is the affected community. So they are probably under the influence of the media that is already there. So that influence, that impact of the media over the affected community, that changes the kinds of documentation that is being done in present time. So that is to be studied also कि हमारे documentation में media के influence का कितना असर पड़ रहा है. And then last but not the least, most documentations are in the report format. Rather, they should be scientific documentation with respect to psychosocial care and mental health services. Now, as far as finance is concerned, short-term planning, the state government, they have the capacity. If we go for long-term planning, probably this SDRMF and NDRMF needs to be brought in with respect to providing finance for these kinds of services. Also, this should be mentioned in the Disaster Management Act 2005, so that यदि वहाँ एक्ट में मेंशन होगा, then only the governments will be thinking about providing specific earmarked kinds of finances with respect to long-term planning and preparedness in the area of psychosocial care and mental health services. The last few slides, these are very, very important aspects. Probably in our country, 150 million people in India need therapy for their mental health disorders. I'm not talking about any disaster right now. I'm talking about generic, common, normal peace situation. 150 million people require these kinds of services, but only 30 million have that guts to approach the caregivers. Why? Because of the social stigma attached to these kinds of services. आप यदि वहां जा रहे हैं तो आप पागल ट्रीट कर दिए जाएंगे। ये जो मेंटलिटी हमारे समाज में हम ही लोगों ने जो फैला के रखी हुई है, वो प्रोबेबली ये 120 मिलियन जो एक्स्ट्रा पॉपुलेशन है which need to go for these kinds of services for their mental health disorders, this checks them from going. So this is one bad situation as far as our country is concerned. So that kinds of awareness generation is required to be done by the government, by the non-government agencies, NGOs, and anybody who can do it. As individual like this, students who are attending this program, they can volunteer and they can provide awareness generation to the local community. अपने आसपास ही यदि आप देख लें 30 लोगों को एजुकेट कर दें कि देखिए सोशल स्टिग्मा से डरने की जरूरत नहीं है, आपको बाहर आने की जरूरत है अपने अंदर के इस प्रकार के स्ट्रेसेस को, ताकि उसका टाइम से ट्रीटमेंट हो सके. Now the many Indian psychiatrists, this is a very wonderful fact that if you put together the Indian psychiatrists who are available in United Kingdom and United States, if you put together, that population is greater than the psychiatrist that is available in India. Just imagine. हमारे यहाँ के बच्चे जो पढ़ के जाते हैं, because of the greener pastures, because of the जो उनके पेमेंट उन्हें वहाँ मिलते हैं, वो इंडिया में हम उनको प्रोवाइड नहीं कर पाते. तो उनकी संख्या इन 2 कंट्रीज में ही देख लीजिए, तो उनकी संख्या हमारे देश में जो साइकियाट्रिस्ट अवेलेबल है उससे ज्यादा हो जाती है. एक रिपोर्ट I have come across, this is from the Union Ministry of Health and Family Welfare, and it says that our country needs 13,000 psychiatrists. ठीक है, तो आइडियल रेशियो क्या होना चाहिए पॉपुलेशन के साथ में? 1:10,000 होना चाहिए. लेकिन अभी हमारे पास 13,000 में कितने हैं? We have only 3,500. Now if you divide it with our that population, what you will find, for every 2 lakh persons we have only 1 psychiatrist. So this is the pathetic situation our country is facing. So what to talk about providing psychosocial care and mental health services in a post-disaster scenario? Now, if we talk about some figures with respect to clinical psychologists, probably we need 20,000 of them. We have only 1,000. If we talk about the psychiatric social workers, we need 35,000 of such persons. We have 900 only. If we need psychiatric nurses, we need 30,000. We have 1,500 only. So just imagine, I mean, with these kinds of meager, scarce resource, how we are supposed to handle the mental health disorders of 150 million people that is required in our country. So that is one area of concern. This is a huge gap. Government has to think carefully with this regard. And if you talk about the study, that curriculum in our country, then undergraduate medical courses, MBBS level, they hardly focus on psychiatry. So very few mandatory exams and less rigorous courses are there. This has to be improved. And I also said that for psychology and social science streams in the PG level, these stream has to be brought in. Some courses should be there. And then if we talk about the MD and MS studies, not enough seats in medical colleges with respect to postgraduate education in psychiatry, very less super specialization courses. You'd be surprised to know that as far as India is concerned, we have only 2 super specialization courses. One is in child and adolescent psychiatry, the other is geriatric psychiatry. Rather, we should be having 12 to 13 these specialization kinds of PG courses as far as India is concerned. We need those kinds of experts in our country. So what happens? Many psychiatrists leave the country for better prospects abroad. As I said earlier, they UK चले जाते हैं, US चले जाते हैं. Limited awareness among people. लोगों के पास जानकारी भी कम है. Social stigma I talked about associated with mental illnesses. This also forces that if at all they are going to serve in our country, they are not going to get proper patients. So तुलना कीजिए एक MBBS जो नॉर्मल डॉक्टरी पढ़ के जाता है और एक MBBS जो सेक्रेटरी पढ़ के जाता है, जब वो 2 दोस्त आपस में तुलना करेंगे, तो नॉर्मल मेडिकल पढ़ने वाला जो किड है वो ज्यादा अर्न करेगा, उसका सोशल स्टेटस ज्यादा अच्छा होगा, और इसका नहीं होगा तो ये क्या करेगा? कंट्री छोड़ के बाहर चला जाएगा. So that is happening in our country. Now, if we talk about the government steps that have been taken in this regard, in 1982, if I remember, then we brought National Mental Health Program, NMHP, to improve the status of mental health in India with specific 3 important components like how to treat mentally ill people, how to rehabilitate those persons, how to prevent and promote their positive mental health. Then in 1996, I talked about that this DMHP, that District Mental Health Program. It was launched in the year 1996. It is a very wonderful program, and it provides community mental health services at the primary healthcare level. But this needs to be strengthened. Then came in the 1987 the Mental Health Act. Then recently we have had this Mental Health Care Act 2017. It has replaced the old act. If we talk about globally, then World Health Organization, it has brought comprehensive mental action plan of 2013 to 2020. This was adopted by 66th World Health Assembly. Then in my first talk, I talked about Sustainable Development Goals, specifically the 3.4 to 3.5. They talk about reducing mental illnesses within the population. So this is very strong message as far as global, policymakers, they are going to provide to the countries across the globe. And then this Mental Health Atlas of 2017, this was brought together by the WHO. Then our own constitution provides these kinds of facilities, like Honorable Supreme Court has held that healthcare is to be the fundamental right under Article 21 of the Constitution. So at ground level, how far this is true, that is $1 million question, but definitely Honorable Supreme Court says that it has to be our fundamental right under Article 21 of the Constitution. Now, specifically, if we talk about Mental Health Care Act 2017, this is basically the right to make an advance directive. It gives the right to the state governments, to the central government, that they can, in advance, they can make directives with respect to what has to be done with these kinds of patients. Then as far as patients are concerned, they can state, वो बोल सकते हैं कि मुझे कैसे treatment मिलना चाहिए या मुझे treatment नहीं लेना है. That right is lying with the patient. They have the right, यदि वो खुद नहीं बोल सकते हैं, they have the right to appoint a nominated representative on their behalf to talk about their health-related conditions and taking decisions with respect to that. They have right to access mental health care. They have right to free and quality services under this act. They have right to get free medicines, for community living, for protection from cruel, inhuman, and degrading treatment. Then they have right to live in an environment safe and hygienic, having basic amenities. Also, they can be provided legal aid if they want to. Two important aspects I want to discuss over here, that no electroconvulsive therapy. पहले उन्हें पकड़ के आप electroconvulsive therapy जबरदस्ती दे देते थे. लेकिन as far as this act is concerned, now no electroconvulsive therapy can be given to them without anesthesia. Anesthesia उनको देना ही है. Also, पहले लोग suicide कर लेते थे तो पुलिस उनके पीछे पड़ जाती थी. Now attempt to commit suicide is not an offense. To help these kinds of persons who have suicidal tendencies, we have made changes in the section 309 of the Indian Penal Code, which criminalizes the attempt to suicide. Now, a person who attempts a suicide, it will be presumed that he is suffering from severe stress and shall not be subjected to any investigation or prosecution. So, basically, this act envisages establishment of central mental health authority and similarly state mental health authorities. So, this have been done at several states and also at the central government level. So, this is a very welcome step from the central government. Now, few initiatives taken by the state governments, if we talk about, this is one initiative taken by state of Odisha to relieve the distress of the student community there due to this COVID-19 pandemic. Our aim is to provide cognitive emotional rehabilitation services to all university students of Odisha. Because of social distancing and self-isolation kinds of mechanisms during the times of pandemic, it has led to decline in social interactions among the student community, so which has further impacted their mental health scenario, their physical health scenario. So it is this Bharosa kinds of a scheme. It is called the social. It is going to improve the social recession. We talk about economic recession. So this social distancing has brought social recession among the student community. So this Bharosa is to provide services with respect to doing away with the social recession. So benefit is this app. This is an app. It is going to provide mental and psychological assistance to the students who need these kinds of help. Then Manodarpan is one initiative by Ministry of Education to provide psychosocial support and counseling to students for their mental health and well-being. Then also another scheme of government of this Ministry of Social Justice and Empowerment This is 24/7 toll-free helpline that is called Kiran to provide support to people facing anxiety, stress, depression, suicidal thoughts, and other mental health concerns. And those persons who are in distress, maybe because of pandemic or because of some other issues as well. So this Kiran is going to help them. So this is 24/7 service. It is going to offer rehabilitation services. Objective is early screening of these kinds of persons who need these kinds of helps, then to provide first aid and psychological support, and also go for their distress management and promote positive behaviors in a later part of time. So, sorry, it is available in 13 languages and has 660 clinical rehabilitation psychologists who are specifically working in this area, and there are 668 psychiatrists also who are working as volunteers to help the person. It's being coordinated by the National Institute of, for the Empowerment of Persons with Multiple Disabilities, and based in Chennai, and National Institute of Mental Health, sorry, of Mental Health Rehabilitation. SIHO. Just a moment. Yeah. So helpline, sorry. So helpline operators have been sensitized that not to ask the caller for name or any identification details, so that their privacy can be maintained. Now, this is very important. Ethics and confidentiality for the psychosocial caregivers. When I am sent to a site to provide psychosocial care, I have to make no false promises to the survivors. I have to maintain their confidentiality, their private information, their problems. I will only share this information if that patient has been taken away from me and has been provided some higher authority for providing a specific kind of psychosocial care. Only then I will provide this case analysis and other private information I will share with my senior. Otherwise, God forbid, I am not supposed to do anything with respect to sharing their information with anybody. So this is point number one. We should be having the commitment. We should be having the commitment to strive to help and support the survivors in any situation in unbiased manner. उसमें किसी फैमिली को नहीं देखना है, स्पेसिफिक किसी नियर डियर को नहीं देखना है, सबको एक इक्वल अटेंशन, इक्वल ट्रीटमेंट देने की जरूरत है. साइड बाय साइड जब हम केयर गिवर के रूप में साइड पे जाते हैं, तो वी हैव टू हेल्प आवर को-वर्कर्स आल्सो. वी हैव टू टेक केयर ऑफ आवरसेल्व्स. पहले अपना देखना है, अपनी सुरक्षा पहले करनी है, देन अपने को-वर्कर की सुरक्षा करनी है, और हमें वी हैव टू बी इन टच विद ईच अदर एज को-वर्कर्स. ये इसको बोलते हैं बडी सिस्टम. हमेशा इस टाइप के काम में दो लोगों को साथ में भेजा जाता है, अकेले नहीं भेजा जाता है. तो वी हैव टू रिमेन इन टच विद ईच अदर थ्रू ईमेल, टेलीफोन, पर्सनल विजिट्स एटसेट्रा in a non-disaster period also, so that bonding is going to work on the site when we are providing services to the impacted community. So whenever the pressure of work or dealing with human suffering becomes stressful, हमें साफ बोल देना है, no, इसके beyond मैं काम नहीं कर सकता. Suppose your duty is for 6 hours or 7 hours, beyond that you have to say no, because somebody else will come and fit into your shoes. If at all you say that मैं कर सकता हूँ, so what would happen? By the end of 9th hour or 10th hour or 11th hour, probably you are not in a position to provide the kind of services that is expected from you. While providing these services, we have to keep smiling and spread smiling among others. So last two slides, these are some suggestions. So definitely we have to increase our resources. It can be infrastructure, it can be improving our capacity of institutions, it can be improving our primary health centers, HR services, the trainings, skill development, and also the increasing awareness of the local community. Now, primary health care center, if we talk about, then it is one against population of 51,000. This is a pathetic situation. If we talk about the mental care health services that has to be provided to the impacted community. So what we do, we need to provide more investment in the PHCs. One estimate of the World Bank says that 90% of basic health needs can be met at the PHCs. So यदि ये इन्हें हम इन्वेस्टमेंट और देंगे, यदि उन्हें स्ट्रेंथन करते हैं, तो लोकल पॉपुलेशन जो होगा रूरल सेक्टर का, इंडिया में वैसे भी 67% पॉपुलेशन रूरल है, उनकी मेडिकल हेल्थ जो केयर की जो नीड्स है यदि वहीं प्रोवाइड हो जाए पीएचसी में, तो वो पॉपुलेशन बड़े शहरों में नहीं आएगा, तो वो सबके लिए फायदेमंद होगा. The kinds of services that we are providing, that should be easier, that should be cheaper, that should be faster. ये access उनको faster होना चाहिए. Plus training at grassroots level, जो आशा वर्कर्स होते हैं, एएनएम वर्कर्स होते हैं, आंगनवाड़ी वर्कर्स होते हैं, इनको इस टाइप के ट्रेनिंग रेगुलर देने की जरूरत है. Then we can go for digital initiatives also. One example I can give for this schizophrenia research India, they are providing this mobile bus clinic also. And in some sectors to improve rural India's mental health is being provided through telemedicine also. So patients don't need to go to the doctor through digital initiatives, through this like this course, this is being provided, this training workshop is being provided online. Similarly, doctors and patients can be put together to each other through digital initiatives. Then we go for community partnerships, self-help groups. I earlier said, of the affected community, of the carer families, that can be put together along with NGOs to provide these kinds of facilities with some of the experts that have been going to be provided by either government or non-government agencies. Then healthcare is a state subject, but when it goes, if we remember the definition of disaster, when it goes beyond the coping capacity of the affected lot, that community, then comes the role of the central government. So there should be a better coordination between the central government and the state government with respect to providing these kind of services. Then psychotropic drugs should be included in essential drugs list, so it is easily available if somebody requires these kinds of drugs. So this delivery of service should always be empathetic, it should be sensitive, it should be compassionate, it should be free from stigma, discrimination. हमें awareness generation के through बार-बार affected community को बताने की जरूरत है कि वो बाहर आए अपने इस grief और स्ट्रेस को लेके, वो बताएं. जब तक वो बताएंगे नहीं, उन्हें सर्विसेज प्रोवाइड कर पाना पब्लिक हेल्थ केयर इंस्टीट्यूशन में बहुत मुश्किल होगा. Last but not the least, the financial support for direct costs of treatment has to be covered by the government, and families are not overburdened. This is one important area that we need to take care of. This is the last slide, that mental health has to be a priority. Immediate crisis intervention is very, very important. We need to take care of that, and helplines to prevent mental health and reducing stigma associated with it through awareness generation, through public awareness programs, through community outreach programs. We have to go for that. We have to advocate for mental health outcomes, strive for early identification treatment. जितना जल्दी mental issues जो होते हैं वो identify होते हैं, उनका treatment उतना आसान हो जाता है. And we can use the digital transformation through this National Digital Health Mission. This is available on the net. You can go and watch this program to provide mental health care to all. We need to provoke masses, the local community, to learn about mental health through campaigns like Swachh Mansikta Abhiyan. ये central government द्वारा चलाया गया एक अभियान है. And finance is very, very important. We spend only 0.05% of our health budget annually on mental health over the last few years. But if we compare our surrounding these countries, like though they are poorer than us, like this Bangladesh, Sri Lanka, this Nepal, Bhutan, they are spending more than us. Like they are spending near to 0.5% of their healthcare budget. So we have to learn lessons from these neighboring countries and accordingly improve that ratio of that expenditure, that is or this financing that is required in the sector. That's very, very important. So with that I end my talk, and this is very important quotation, that we have to smile while it is still we still have our teeth. So life is too short. So we have to take care of not only ourselves in a time of disaster, but rather the near dears, our family, friends, and everybody, our colleagues and our co-workers. If I am a caregiver, I have to take care of my co-worker as well. So with that, I end my talk. Thank you so much.
Thank you so much, sir, for such a wonderful presentation on psychosocial care. You talked about various psychological stages during and post disasters, and you also talked about it was a neglected field for so many years, and now it has been given its priority by the government and various organizations as well. I also like the point where you said that the use of local languages is very important, because हमारे प्राइम मिनिस्टर सर भी बोल रहे हैं कि लोकल फॉर वोकल फॉर लोकल, एंड जब तक लोगों को उनकी ही भाषा में बात समझाई नहीं जाएगी तो उन्हें कुछ भी कोई फायदा नहीं है उस ज्ञान का, अगर उन्हें उन्हीं की भाषा में ना समझाया जाए. So I'm sure that our participants will be benefited with your talk. Thank you, sir. And now moving ahead with our next speaker, Engineer Avdesh Kumar, sir, Invertis University. Engineer Avdesh Kumar is presently working as an assistant professor in Department of Civil Engineering with Invertis University, Bareilly. He has almost 7 years of experience in the field and academia, and he has associated with Himal Infratech Private Limited as a consultant for ground rooftop solar projects. In his career, Sir worked on projects focusing on soil stabilization using brick kiln, dust, and waste coir fiber, designing residential block with special reference to green building concepts, enhancing properties of concrete in variable climate conditions, lateral water harvesting plan in urban colonies, etc. Sir has a keen interest in the field of disaster management and currently working on localized area pilot study of Baheri village with respect to HVR, CA and DMP, case study of Rohilkhand region. Along with role as an educator, he is also a part of Invertis University's various committees such as Council, Board of Studies, IQAC, Examination, etc. He is also life member of Indian Red Cross Society and actively involved in various social awareness programs. Sir will be talking about disaster impact assessment and overview. Over to you, sir, for your talk, please. Sir, kindly unmute yourself first.
Well, it's unmuted now. Thank you, Shilki ma'am, for introducing me to the gathering. And I would like to thanks Nidm and Isabella Thoburn College for inviting me for my talk. And not talk, because talk is not a good word, I think, because too many talk. So we will discuss. It's a discussion. It's a kind of discussion, actually. And Ashish sir, if you are available, then I was little bit excited when I get to know that Isabella Thoburn College share a sister relationship with Invertis University. And when Dr. Sonika Bhatia ma'am sent me the invitation, then I saw the logo. There is a 1880-26 was there. So we had a conversation, and then we get to know that it has a sisterly relationship. So before going into the tough topic is like the disaster impact assessment, DIA, or going into the details, I would like to talk about Prime Minister 10-point agenda, point number 3. Yeah, we all know, Ashish sir, we are working on this from last many years, and Prime Minister's 10-point agenda, point number 3, is basically dedicated towards encouraging the greater involvement and leadership of women in disaster risk management. लेकिन जैसे we wanted to share some video यार, क्योंकि एक बात हमने देखी थी कि 70% of communication is conveyed through the body as per the communication expert, but here we have the restraint. So as you say that we can we share the video with the participant. So मैंने कहा कि वीडियो नहीं, अब कुछ और शेयर करते हैं कि स्टोरी है सर, आपको भी अच्छी लगेगी, और सभी पार्टिसिपेंट जितने भी आज हमारे साथ जुड़े हैं वो भी इसको देखें. और ये जो 10 पॉइंट का पॉइंट नंबर 3 है, इसकी शुरुआत कहाँ से कहाँ तक हुई है इसको देखें. और यहाँ पर इन्वर्टिस एंड इसाबेला थॉबरन का जो सिस्टर रिलेशनशिप है इसको भी मैं प्रेजेंट करूँगा. सो प्लीज लेट मी नो if my slides is visible to all of you. Is it visible?
Visible. You can make it full screen, sir.
So these I am making is full screen. So please एक स्टोरी की तरह पहले सुनिएगा, उसके बाद हम डिजास्टर इम्पैक्ट असेसमेंट पे भी बात करेंगे और कैसे शुरुआत होती है. हमारी जो वुमेन एम्पावरमेंट में बात हुई है, द पिक्चर दैट यू आर विंग ऑन योर स्क्रीन इज जेम्स मिल्स थॉबरन, and he was born in March 7, 1836, and he was American bishop of the Methodist Episcopal Church, and he best known for his missionary work in India, right? So this was set up then after that Women Foreign Ministry Missionary Society, WFMS, was founded at Boston, America in 1869, and to cause the companion of the women all around the world, including in India. So then there he has a sister, and you can see this familiar name, the Isabella Thoburn, and she was the first Christian. She established the first Christian college of women in South Asia, and it was the first Christian college of women in South Asia. Its founder was Isabella Thoburn, on which the college is basically named, and it was the first American woman Methodist missionary to sail India in 1869. So this was about the Isabella Thoburn. But parallelly, when I was talking with the ma'am, so I get to know that there is a hospital named Clara Swan Hospital at Bareilly. बरेली में एक हॉस्पिटल है, and it was established by Dr. Clara Swan, and she was the first woman doctor, and she founded this first women's hospital in Asia. And this is basically to take care of the women and children medical care, and it is also Isabella Thoburn is also associated with the women's education and level up their knowledge and also their living standard of living. So these two people work together, one from the Lucknow, and now I'm sharing second slide. तो एक पत्थर आप देख रहे हैं यहाँ पर 1886 का इसाबेला थॉबरन कॉलेज फाउंडेड का लगा हुआ है, और इधर आप देखेंगे तो क्लारा स्वान हॉस्पिटल पे 1870 लिखा होगा यहाँ पर। तो ये दो कॉलेजेस हैं, ये एक बरेली में है जहाँ पर मैं बैठा हूँ अभी, और दूसरे जहाँ पर मैं कनेक्ट हूँ इस वक्त वो लखनऊ में लगा हुआ है। तो ये एक बड़ी यूनिक रिलेशनशिप है, और हमारे में कैसे वुमेन्स का एलिवेशन किया, लोगों ने कितना काम किया। हम चाहते हैं कि कोई केवल नाम ना रहे, कॉलेज कोई नाम ना रहे कि हाँ इन्होंने इनवाइट किया, उनके साथ हुआ और हमने उसे अटेंड किया, हमने एक सर्टिफिकेट लिया। वो लोग जाने कि यहाँ पर कैसे शुरुआत हुई, किस तरीके से हमने एजुकेट किया और कैसे ये आगे बढ़ता चला जा रहा है अभी। तो आज का भी कार्यक्रम इसी सिलसिले में है, और आज मैं जो बोलूँगा वो डिजास्टर इम्पैक्ट असेसमेंट पे बोलूँगा। ये भी एक बड़ा नया टॉपिक है। एक्चुअली आप सभी ने 1970 के इन्वायरमेंटल इम्पैक्ट असेसमेंट EIA के बारे में सुना होगा, but it is about the disaster impact assessment. My presentation now, I am formally begin my presentation. Hope you like that. So disaster impact assessment DIA is basically dealing about the impact assessment of calamities, catastrophe, and disaster that are outbreak in all around the world. This is not a problem that is basically limited to a particular area like India or Asia, or it is all around the world going on. जैसे इन्वायरमेंटल इम्पैक्ट असेसमेंट के बारे में सभी जानते हैं कि यूएसए से 1970 के अराउंड इसका एवोल्यूशन हुआ. नाउ इट इज mandatory by many monetary organization. They will impart you the fund to the countries when you satisfy the EIA guidelines. Similarly, now a new voice is raising all around world about the disaster impact assessment. So before that, as I have heard the speaker, they were saying that there is no act of God. We can't say that anything is act of God, right? And then our Professor Anil sir also say that there is a no natural disaster. Somewhere हमने कुछ खुरापात, कुछ ना कुछ कारस्तानी की होती है जिसकी वजह से ऐसा होता है. So that is about our position in the universe. I would like to begin from there. So this first thing, we can be happy that we are our planet is the part of Goldilocks zone. So हम कह सकते हैं कि हम लकी हैं. हमारे अर्थ पे कुछ भी ना होता अगर ये गोल्डीलॉक जोन में ना होता, जिसको हैबिटेबल जोन कहते हैं. ना तो ज़्यादा ठंडा ना तो ज़्यादा गर्म, यानी बीच का टेम्परेचर है. जीवन के लिए सबसे मुफीद कंडीशन जिसको कहा जाता है वो यहाँ पर एग्जिस्ट करती हैं. तो पहली चीज़ ये है, लेकिन ये कोई गारंटी नहीं है कि इफ ए प्लैनेट इज इन हैबिटेबल जोन देन देयर इज लाइफ विल बी सस्टेन. सो अगेन you can see there, this is the biosphere, a basic school level diagram that is representing the cause of life on the earth. And here we can see atmosphere, lithosphere, hydrosphere. So it is basically composition of gases, it is basically composition of rocks, mineral and soil, and it is basically the composition of water component. And जब ये तीनों कहीं मिल जाते हैं बिल्कुल सही स्थिति में, तब वहाँ पर हम जीवन को देखते हैं. अब जीवन का होना, कई सारे प्लैनेट्स हैं, हमारे साइंटिस्ट ने ऐसा पाया है कि वहाँ जीवन था, है नहीं, तो यहाँ पर एग्जिस्ट करना एक बहुत बड़ी बात है, अभी भी एग्जिस्ट कर रहा है। दैट इज बिकॉज ऑफ द बैलेंस ऑफ दिस क्रिटिकल कॉम्बिनेशन। अब नाउ वी टॉक अबाउट द स्टोरी ऑफ द इम्पैक्ट। इम्पैक्ट का क्या मतलब है? अगर आप किसी की कोई भी कंपोजिशन को छेड़ेंगे, देन दिस बायोस्फीयर, लाइफ केवल लिथोस्फीयर से नहीं हो सकती है, एटमॉस्फेयर से नहीं हो सकती है, हाइड्रोस्फीयर से नहीं। जब ये दिस इज शेडेड रीजन विल बी देयर, बायोस्फीयर, देन वी कैन इमेजिन द लाइफ। सो व्हेन दिस बायोस्फीयर exists somewhere, sorry, then we can imagine life. But any disturbance in these components will lead to the disturbance in the biosphere. And as per the Isaac Newton, every action has an equal and opposite reaction. And when he said that equal and opposite reaction, then he not defined that कि अपोजिट रिएक्शन तुरंत हो जाएगी या थोड़ा थोड़ा धीरे धीरे होगी। पानी जब एक साथ बरस जाता है तो क्लाउड बस्ट हो जाता है, धीरे धीरे बरसता है तो बहुत आराम से ड्रिजलिंग आप एंजॉय कर सकते हैं उसमें। बट दिस इज द सेम सिचुएशन विद द इम्पैक्ट्स। अगर इम्पैक्ट एक साथ होता है तो हमें लगता है कि एकदम हमारे ऊपर कुछ इम्पैक्ट हुआ, लेकिन कभी कभी धीरे धीरे होता है तो उसको कोई काउंट नहीं करता है, राइट? सो दिस यू कैन सी दैट इन ऑल द प्रोडक्ट्स दैट आर रिसोर्टेड टू द लिकर्स, उन पे एक वार्निंग मेंशन होती है कि इट इज इंजूरियस टू हेल्थ, लेकिन अगर उसको कंज्यूम करने के तुरंत बाद अगर किसी की डेथ हो जाए तो कोई भी कंज्यूम नहीं करेगा, बट वो धीरे धीरे अपना इम्पैक्ट डालता है, इस वजह से सभी लोग उसको गो ऑन रखते हैं। सो दिस इज द स्लो ऑनसेट ऑफ इम्पैक्ट्स। एंड हियर इज ए पिक्चर ऑफ 1914 1918. Of course, it was the crucial time of the world, for the world. This was the time for the World War I. You can see the condition of the soldiers sitting here. This I will show you another picture that is also from another World War, that is 1939 to 1945. But this picture is important because यहाँ से एक problem थी कि disasters are natural and man-made, and war is also a man-made disaster, we can say. So in man-made disaster, यहाँ पर जो इसको खंदके बोल सकते हैं आप, खंदकों में जब ये लोग बहुत समय तक रहते थे तो एक हफ्ते तक कोई भी पार्टी इनको रिलीव करने नहीं आती थी। they hear high decibel sounds of bullet fires, tanks and other weapons. इस सिचुएशन में लगातार हाई डेसिबल साउंड में रहने के बाद में सिचुएशन ऐसी हो जाती कि इनकी जो सिचुएशन होती थी, इनको न्यूरोलॉजिकल डिसऑर्डर्स होने शुरू हो जाते थे। और इन न्यूरोलॉजिकल डिसऑर्डर्स में जब ये इस खंदकों से उठकर खड़े होते थे तो अगर उस सिचुएशन में खड़े हुए तो वहां पर बुलेट लगातार फायर हो सकती हैं, या तो ये डेथ हो जाती तो या इनकी डेथ हो सकती थी, कैजुअलिटीज हो सकती। तो नतीजे में ये लोग कई समय तक ऐसे ही पड़े रहते थे इसी पोजीशन में। ये देखने से लग रही है ये लोग कई 10, 15, 20, 25 दिन तक पड़े रहते हैं। तो ऐसी सिचुएशन में जब ये निकलते थे, इनको कोई पार्टी रिलीव करती थी तो ये कांपते हुए बाहर निकलते थे। इनके हाथ कांप रहे होते थे, इनकी आंखों को दिखाई नहीं पड़ रहा होता, धुंधले हो जाते थे, कानों को सुनाई देना बंद हो जाता था। ऐसी सिचुएशन होती। तो इस सिचुएशन को पाइलू बोला गया। तो पाइलू एक एक्चुअली इंसान और ह्यूमंस के और ह्यूमन और हमारा जो आदि मानव है इसके बीच की कड़ी को कहा गया। उससे पहले लोगों की राय ये थी कि दुनिया आगे को प्रोग्रेस कर रही है, यानी हम इंसान डेवलप कर रहे हैं। लेकिन ये वर्ल्ड वार जो 1914-18 और 1939-45 हुआ तो इसमें पहली बार देखा गया कि हम लोग बैकवर्ड प्रोग्रेस कर रहे हैं। तो ये पोजीशन ऐसी थी। तो डिजास्टर्स का ये इम्पैक्ट की पहली जो एक मैंने पिक्चर आपको दिखाई है कि डिजास्टर कैन इम्पैक्ट एंड टू अ ग्रेटर लेवल, नॉट ऑन टू द physical one but on the mental too. Ashish sir also talk about in his lecture about the psychosocial impact of disaster. So this was some things that are associated with the impact. Now for more, Hiroshima and Nagasaki आप कभी बेसिक किताबों में पढ़ेंगे, then you will read that there is the residue of impact are still on the people. जहाँ पर हिरोशिमा नागासाकी में लोग रहते हैं वहाँ पर अभी भी इसका असर बरकरार है। तो ये इम्पैक्ट अभी तक उस डिजास्टर के यहाँ बरकरार है। इसके बाद भोपाल गैस केस का 30 साल हुए। वाइड स्पेयर केस ये जब हुई थी तब तो लोग मारे गए थे, लेकिन उसके बाद भी बहुत ऐसी रिपोर्ट्स आई जिसमें इंडियन काउंसिल मेडिकल रिसर्च ने पाया कि जो प्रेग्नेंट लेडीज हैं उनके ऊपर इसका इम्पैक्ट पड़ा है। तो यहाँ पर 3 दशक के अंदर लगभग 15,342 15,342 पीपल्स लॉस्ट डेथ and a number of people are affected too. So this was the aftermath of this Bhopal gas case. Then we also have evidence that nuclear power plant accident reported in Soviet Union, probably known as Chernobyl, and it was held in 1986 at Russia. So you can see this position of the things. ऐसे के ऐसे ही हैं जैसे वहाँ पर जो भी fun park होगा बिल्कुल वैसा ही का वैसा बना हुआ. Now it is a tourist place, but still radiation is there in these places. This is the tsunami impact, and it has if I say that it was more than a physical devastation, it also do a lot of social devastation too, including impact on the languages. यहाँ कई जैसे लोग थे जो बड़े लिमिटेड से लैंग्वेज बोलने वाले, वो भी वहाँ वैनिश हो गए. तो इस तरीके से ये impacts को हम लोग अभी देख रहे हैं. Now 2013, we all know that tsunami is not only limited to the coastal area. Our country is evidence of the Himalayan tsunami. In Kedarnath site satellite view, you can see into 2013 there's a multiple impact on the debris. So debris is all around 5. A road cut off was there. Road cut off. If road is cut off, you cannot perform any rescue operations here. जब ये सिटी बना होगा कुछ नहीं हुआ होगा, यानी मान लीजिए 2013 से पहले 12 में, तब यहाँ सब कुछ ठीक रहा होगा तो आउटब्रेक होने से पहले, तो इसमें क्या है सब कुछ कनेक्ट था. लेकिन जैसे ही ये डिजास्टर हुई तो ऐसा हो गया. अब इसका किसी ने असेसमेंट नहीं किया था कि ऐसी सिचुएशन बनेगी. नतीजे में इसके रेस्क्यू ऑपरेशन में बहुत सारे हमारे जो डिफेंस फोर्सेस में जो रेस्क्यू ऑपरेशन में लोग लगे थे उनकी भी जाने गई. सो दिस इज अनदर क्रूशियलिटी resulted due to the disaster. Now, what is the situation for today? So, after the global launch, हमने दुनिया में 2 global launches को देखा है जो कि हमारे disaster risk reduction के बारे में. First name is HYGO framework, and it ran for the 2005 to 15. And then we today currently 2015-30, it is Sendai framework for disaster risk reduction. The globe is following. So in this, after this, sensitization of this disaster issue all around the world, so including the developing country, the condition of the disaster risk management improve a lot. Most of the country, but you know, this, if you see the disaster environmental impact assessment is a long topic actually. Environmental impact assessment process, then you will see a parameter that is assessment. So this assessment part is not including till now the system. It is in most of the country there is no systematic tool for mainstream the disaster risk reduction into the development planning. उनके development plan कैसे चल रहे हैं इसके ऊपर कोई EIA या SEA process के अंदर systematic approach disaster risk reduction को लेकर नहीं है, और हैं भी तो उनको follow वैसे नहीं किया जा रहा है. Then ये environmental impact assessment के अंदर कि एक weakness हम कह सकते हैं कि है. इसके बाद need of disaster impact assessment, you can see these two. One is picture and second is the text. So in text, in currently in the most of country, EIA only consider another limitation. EIA only consider the potential hazard from the proposed development to the environment and hazard from the environment. जो हम बना रहे हैं बस उससे जो potential hazard होने वाला है, जो भी hazard आने वाले हैं, इनका हम assessment कर सकते हैं. But the hazard from outside impacting the proposed development is not systematically captured by the EIA and SEA process. So even though this external hazard could impact the project leading to environmental impact, कोई जरूरी नहीं है कि आपके प्रोजेक्ट की गड़बड़ हो तभी ऐसा हो सकता है. अगर वहाँ पर कोई एक्सटर्नल फैक्टर्स भी हैं, एक्सटर्नल हजार्ड इम्पैक्ट है, तो वो भी प्रभावित कर सकते हैं. सो दिस इज अनदर वीकनेस. एंड इफ यू सी दिस सस्टेनेबल गोल्स SDGs, we popularly know this by the name of SDGs. So you can see no poverty, right, and many other under decent work and economic growth, and you can see this climate change. Lots of there 17 SDGs are total there, but I am telling you the example how disasters impact this SDGs. जब भी डिजास्टर आउटब्रेक होगी वहाँ की जो पॉपुलेशन गरीब होगी या फिर जो पुअर पॉपुलेशन होगी उस पर बहुत ज़्यादा इम्पैक्ट पड़ेगा. ये प्रीवियस डिजास्टर का एक्सपीरियंस है, हमेशा चलता रहता है, और एक कॉमन सेंस भी है. अगर किसी भी व्यक्ति को कोई बीमारी हुई और उसके पास पूरे संसाधन हैं, लाइफ इंश्योरेंस है, हेल्थ इंश्योरेंस है, he can cope up with that disaster, but the person who not have such type of access to different to different these medical facilities. Of course, it will be the poor section of the society. So that disease can take his life. So this is another impact of disaster on the relation between the poverty and disaster. और जब भी हमारा कोई डिजास्टर आउटब्रेक होता है एक बहुत बड़ा बजट पास करना पड़ता है. जैसे एम्फन साइक्लोन आया था अभी भी उसमें करोड़ों का बजट उसमें गया. 432 करोड़ रुपए यूपी के अंदर सैंक्शन होता है फ्लड के लिए. देश का बजट बहुत ज़्यादा, कई देशों का बजट बहुत ज़्यादा डिजास्टर से लगते हैं. तो इसमें तो इफ frequency of disaster increase, then you have to issue budget and again to cope up with that disasters or disaster outbreak. And as a result, your economy cannot be stand on your on the both legs. And climate change action is also the negligence of the sustainable development. I request all the participants to please mute yourself. Climate change, unsustainable development may lead to the climate change situation more worse. This fish you can see life below the water. So these are some impact on the we can say the terrestrial and aquatic ecosystem both are and biodiversity both are going to hit with this type of unsustainable development and unsafe developments. Now disaster impact we can see here. So what is the exact meaning of disaster impact assessment? We have seen the pictures related to the impact. We have seen the picture that were telling the story of effect on various global targets and various type of other associated areas. But what is the meaning of the disaster impact? How can we divide this? So this is the standard definition you can see on your screen. So this is the methodology basically, like the environmental impact assessment, to access the development projects from the viewpoint of the disaster risk reduction by identifying and improvement points to the project. जहाँ environmental impact एक multiple assets को parameters को deal कर रहा है, वहीं disaster impact assessment किया ही इसलिए जा रहा है कि हम सिर्फ disaster risk reduction को focus कर सकें. And this you can see this UNICEF United Nations international strategy for disaster risk reduction data from 2000 to 2012, where 1.7 trillion damage was recorded in US dollar, 2.9 billion people affected during this period, and 1.2 million people killed with this. So this slide is showing you a system of disaster impact assessment system. कोई बहुत diagram डरावना दिख रहा होगा, but it is not. Diagram is so simple. अगर कोई disaster are unavoidable. This is the truth, and it is better to accept this because no one can guarantee that no disaster outbreak tomorrow, today. So this is disaster unavoidable. But its impact is in our hand. So when disaster outbreak, then we can record this and send the report, and then we review that impact, and then and this process is done by the relevant agencies working in the field, and with their coordination we can take action according to that. So as a result we will review of standard update. जो भी updates हमको करने पड़ेंगे वो हम कर लेंगे, और स्टैब्लिश जो सर्वे सिस्टम हम लोगों को, जो मेंटेनेंस सिस्टम हम लोगों को करना पड़ेगा, जो अरेंजमेंट हम लोग लाइफ साइकिल एनालिसिस में करने पड़ेंगे, इन सबको हम इनकॉर्पोरेट करेंगे और फिर इसको आगे भेज देंगे. देन दे विल बी इम्प्लीमेंटेड हेयर. अब जब नेक्स्ट डिजास्टर आएगी तो उसका जो इम्पैक्ट होगा वो कम होगा. यही प्रोसेस हम फिर रिपीट करते चले जाएंगे और आखिरी में ये कोशिश करेंगे जितना भी कोशिश हो जाए कि कम से कम होगा. इसी को कहते हैं हम डिजास्टर मिटिगेशन, जिस मिटिगेशन की बार बार बात होती है. और इस मिटिगेशन के बारे में कहा जाता है कि $1 अगर मिटिगेशन पे आप खर्च कर दें तो $6 या $7 आपके बाद में जो बच जाएंगे. तो दिस इज नॉट अबाउट द डॉलर्स ओनली, इट इज ऑल्सो अबाउट द लाइफ ऑफ द पीपल. सो दिस इज अ सिंपल DIA system. Now, objective of DIA is deal with this clarifying the design condition. Whatever you are designing, you have to clarify that. So possibility of disaster is caused by developed action to the surrounded area. And then we have this one also. So where we can see that influence of disaster to the development action itself. And then third process is influence of disaster to the surrounded area caused by the development action which had been damaged by disaster. So these are the three basic objective of we can say the disaster. So after accessing all these three, the possibility of disaster that can be caused, आपने कुछ बनाया उससे कोई disaster होगी तो उसकी क्या possibility है इसको पता लगाया. उसके बाद डिजास्टर जो डेवलपमेंट हुआ है उससे खुद क्या डिजास्टर्स हो सकती हैं, डेवलपमेंट जो आपने किया है उससे कौन सी डिजास्टर खुद भी हो सकती हैं ये. इसके बाद हमने जो इन्फ्लुएंस होगा डिजास्टर्स का उस पूरे सराउंडेड एरिया जो उसका सराउंड जिस एरिया में डिजास्टर हुआ उसको जिसने सराउंड कर रखा है. तो डेवलपमेंट एशिया विच जो भी डैमेज वहाँ पर हुए हैं उनका क्या इम्पैक्ट होगा, इनके इन्फ्लुएंस के बारे में हम एक डेटा तैयार करेंगे. और इन तीनों डेटा को कंबाइन करके, चाहे वो पॉसिबिलिटी हो या उसके जो इन्फ्लुएंस होंगे जो डिजास्टर को बढ़ाने में मदद कर रहे हैं, इनके आधार पे हम काउंटर मेजर्स को कंफर्म करेंगे कि काउंटर मेजर लेने हैं तो क्या है, और इसमें वेदर द रिक्वायर्ड लेवल ऑफ डिजाइन आर रिफ्लेक्टेड टू द डिजाइन. And then we whether the countermeasures against foreseeable disaster are reflected to the several plans and non-structural measures. So this is some countermeasures, and we in this process we will also discuss in the next slide. This is that slide in which we are discussing the role. So जब भी हम डिजास्टर मैनेजमेंट पढ़ते हैं तो दो तरीके के डिजास्टर को हम देखते हैं, एक नेचुरल डिजास्टर है, दूसरी मैन मेड डिजास्टर. But when we talk about the project, then we discuss about natural and technological disaster. So this is design. This is some a diagram showing the role of disaster impact assessment. And here we can see the natural disaster is basic, very much depend on the projected area, projected plan or projected project. यहाँ क्या है कि कोई भी प्रोजेक्ट है, चाहे वो डैम का प्रोजेक्ट हो, चाहे वो कोई भी एक न्यूक्लियर प्रोजेक्ट हो, किसी भी तरीके का आप जो भी कंस्ट्रक्शन कर रहे हैं, तो इस पे हमारे कई दो बातें मेन डेवलप करेंगी. सबसे पहली चीज़ ये है कि डिज़ाइन कंडीशन में उसकी मोर एंड अदर देन डिज़ाइन कंडीशन देन अंडर डिज़ाइन कंडीशन, क्या वो अंडर जो भी हमारी प्रॉब्लम अराइज हो रही है उस कंस्ट्रक्शन से या उस डेवलपमेंट से उस किसी पर्टिकुलर एरिया के अंदर, वो अंडर डिज़ाइन कंडीशन है या फिर डिज़ाइन कंडीशन को हमने ध्यान में रख लिया है, ये उस किसी और वजह से आ रही है. तो ये दो कंडीशन कंसिडरेशन है. एंड इन दिस वे नेचुरल डिजास्टर अगर है तो उसमें आप कुछ खास नहीं कर सकते. It is difficult to prevent from any kinds level of disaster because you cannot predict that what will be the level of disaster. Now with the help of the emerging technology we can do to some extent, but it is predictable. It is also the truth. And then we see the technological disaster, and disaster should not be generated. We can ensure that disaster should not be generated by doing the effective disaster impact assessment of the project. And then for that we will need to prepare how to avoid the damages, and in parallel, if it is in case of the technological disaster, we need to ensure the suitable design and countermeasure. If it is a natural disaster, you can say that if you can save yourself and your infrastructure with the help of the proper preparedness. You design the things suitably, and as per the countermeasure that we have discussed in the previous slides, whatever the countermeasures you have concluded from accessing all those 3 points that I have discussed in the previous slide. So this if you incorporate this in the design, or we can you can save yourself with the technological disasters. Then we have to clearly clarify the line between to define the risk and to anticipate damage as much as possible, and not to trigger or generate disaster which should be prevented. इसमें वही चीज़ है जिस चीज़ से आप बच सकते हैं. फॉर एग्जांपल अगर कोई व्यक्ति बाइक पर जा रहा है एंड ही इज़ नॉट wearing the helmet, तो अगर उसका एक्सीडेंट होता है तो इस डिजास्टर और एंड हेड इंजरी उसको होती है, तो इस डिजास्टर से वो बच सकता था, इफ ही टेक द प्रॉपर precautions, like he can wear the helmet and he can run the bike or the car or whatever the vehicle he is going within the appropriate speed limit. So these things that those that are basically triggered from the technological fault, this we can control or at the design level, and those that are basically the result of some very unpredictable, like the earthquake. So for there we can go for this type of strategy. Now this is the ideal stage of disaster. It is basically the plan of a road construction in the that took place in Sri Lanka. So here they first perform the pre-feasibility study, then go for the feasibility study and detailed design. These three components are not very difficult. इनको जो technical से निकल के अगर आम भाषा में समझे हम, तो अगर आपको कोई भी चीज़ खरीदनी है फ्लिपकार्ट पे फॉर एग्जांपल, तो आपको अगर कुछ खरीदना है तो सबसे पहले आप एक सरसरी निगाह से देखते हैं, उसके बाद फिर थोड़ा सा और अच्छी तरह से देखते हैं, उसके बाद फिर उसको डिटेल में देखते हैं। ऐसे ही अगर हमें कोई प्रोजेक्ट लगाना तो पहले हम ये देखते हैं क्या वो फिजिबल है भी वहाँ पर नहीं है, तो फिजिबिलिटी तो ऐसे ही चेक हो जाएगी सबसे पहले कि क्या वो प्रैक्टिकली पॉसिबल है उस एरिया में या नहीं, राइट। अगर कोई कह दे कि मुझे एवरेस्ट की जो सबसे टॉप मोस्ट चोटी है यहाँ पर एक बेस बनाना है, किसी तरीके का क्लब बनाना है, तो that is absolutely nonsense. So pre-feasibility study will tell it wrong. It is example, by the way. Don't think like that you are going to construct something like at Everest. So pre-feasibility study is like this, and then feasibility study, and then we go for the detailed design, and then we come on to the constructional phase. Maintenance is very important, because ये एक जो आपको बॉक्स दिख रहा है, ये भोपाल गैस केस के जो आउटब्रेक हुआ था उसके लिए जिम्मेदार भी था। उसमें आप देखेंगे कि वहाँ पर जो आई थिंक दे नॉट perform the proper maintenance of the factory's safety systems, and when the gas leak, they are not able to control or contain it at a particular area, and as a result it outbreak in entire city, and it took the life of so many people, including children, women, and also the animals. So this is a very important aspect. And also a periodical check is there. Maintenance, if you performed a maintenance and think that you are free from all the future maintenance, and it is not that. It should be the periodical one. And also we should record the disaster, whatever the disaster took place, and what was the region responsible for the disaster. It should be properly recorded, as Ashish Panda sir also said that it should be timely record also, not the properly, but the timely record also. Otherwise the experiences will not be available at the time of the need. So this is the process where the disaster impact assessment, our tool that we are discussing in today's presentation, is actually work. And if we implement it at a very good stage, like disaster impact assessment, when we implement it, then we will go for the first one, the natural disaster criteria that we discussed in our previous slides, and then the technological disasters that have the potential to technological hazard that are have the potential to convert into the disaster. So this is the area where we can implement this DIA. We should implement it because it's the ideal state of DIA, right? Then we can see this need of DIA in development project. So what is the need of the DIA in development project? Unsustainable development भारत में बहुत बड़ी समस्या है, चाहे वो उत्तराखंड का रीजन हो, जो केदारनाथ का हमने देखा था, चाहे वो केरला के पास में जो लैंडस्लाइड हुआ है, लैंडस्लाइड्स हुए थे केरला फ्लड 2018 के तरह, फ्लड डिजास्टर तो थी, साथ में लैंडस्लाइड भी थे, लैंडस्लाइड भी हुआ है। यानी वन डिजास्टर एग्जिस्ट एंड इट विल इनवाइट हिज फैमिली मेंबर टू कम अप एंड आउटब्रेक एट अ पर्टिकुलर साइट। एक डिजास्टर के साथ जब दूसरी डिजास्टर साथ में कंबाइन हो जाती है तो मल्टी डिजास्टर सिनेरियो बन जाता है वहाँ पे, एंड उसको हैंडल करना बहुत मुश्किल पड़ जाता है। So this should be there should be the significance of such studies and such assessments. So disaster can create a considerable damage. Need ये है कि बहुत बड़े पैमाने पर नुकसान करती हैं, losses related to the developmental projects. And we can see that these important actions can be based on the perform the disaster impact assessment of the project, and we will get clear information of the possibilities. What are the possibilities exist if a particular condition hold true, then what may be the consequences, and if a particular condition true in some another way, then what may be the possible consequence in that that. After accessing the with the aim of minimizing the damage, हमारा काम mitigation का है, right? Minimizing the damage and losses action such as analysis of the causal factor of disaster, that are anticipated damages and appropriate countermeasures. एक प्रोजेक्ट एक स्टेज में नहीं बनता, कई स्टेजेस में होते हैं, तो उसके कॉन्सिक्वेंट स्टेजेस में कहाँ हमको क्या क्या करना है DRR के पॉइंट ऑफ व्यू से, डिजास्टर रिस्क रिडक्शन के पॉइंट ऑफ व्यू से। बिकॉज मैंने बताया था EIA और DIA में ये चीज है कि DIA में हम डायरेक्ट DRR को ही फोकस कर रहे हैं, इसमें जो हीरो है वो डिजास्टर रिस्क रिडक्शन ही है, यानी मिटिगेशन के हम काम कर रहे हैं, तो इट विल गिव अस द कोहेरेंट रिजल्ट्स, and these important actions that are based on the result of the revision will be requested by the disaster impact assessment to improve the standard of structure countermeasures। वो हमने जो 3 एरिया देखे थे ब्लैक कलर के स्लाइड्स में, तो स्ट्रक्चरल काउंटर मेजर जो भी होंगे, अगर कोई डिजाइन एडजस्ट कर रही है तो उसमें, और नॉन स्ट्रक्चरल काउंटर मेजर, देखिए एक तो डिजाइन में तो आप जितना भी संभाल लिया, अगर मैं कोई रोड बना रहा हूँ एज ए सिविल इंजीनियर या ट्रांसपोर्टेशन इंजीनियर, हमने कोई हाईवे बनाया है, तो एक तो हाईवे की डिजाइन हमने अप्रोप्रिएट लेके कहाँ पर टर्न आ रहा है, कितना उसका जो है कर्व हमने रखा है, या फिर कितना हमने वहाँ पर किस तरीके के एलिवेशंस हैं, किस तरीके से हमने वहाँ पर अलग रोड सेफ्टी के लिए हमारे डिजाइन कंसिडरेशन है वो होते हैं। लेकिन दूसरी चीज जो होती है कि वहाँ पर फिर भी आपको जो ट्रैफिक जो पुलिस मैन होते हैं आपको वहाँ देखेंगे वहाँ पर मैनेज करने के। दिस इज सेकंड एस्पेक्ट। So here you not only go for the structural measure, you should also go for the non-structural measures that are related to the management portion, where we deal with the evacuation plans, early warning mechanism. In India, the poor evacuation plans are very a great concern. So this is also a aspect of reason why we need the disaster impact assessment in our development plans. So if this disaster impact assessment system is incorporated into our process plans, so we can say that we can minimize the impact of the disaster to a greater or the higher degrees. Now, development projects and disaster situation. So you can see 1, 2, 3. We can classify it into the 3 types. Here, the 3 types of disaster situation where we can classify when we deal with the disaster. We are doing the disaster impact assessment. In situation 1, the simply disaster is caused by the development action to the surrounding area, and situation 2, disaster happened to the development action itself. And situation 3, disaster is to the surrounding area caused by the development action and had been damaged by disaster. जो 3 ब्लैक एंड व्हाइट स्लाइड को मैंने एक डिस्कस किया था, 3 प्रोसेस, उनका ही ये एक्सप्लेनेशन है। इसमें आप देख सकते हैं कि जो डिजास्टर हुई है डेवलपमेंट एक्शन की वजह से, डिजास्टर जो डेवलपमेंट एक्शंस की वजह से डिजास्टर हो सकते हैं कि कहीं किसी एरिया में कहीं बैलेंस बिगड़ा हुआ, आपने वहाँ डैम क्रिएट कर दिया, तो मे बी द साइस्मिक एक्टिविटी में इनहांस इन दैट एरिया, राइट। So this type of situation 1, 2, 3 exist, and in first situation you see that disaster is dominating here. So but in second and third, it is the danger of disaster by the development action itself, and then in third you can see disaster to the surrounding area caused by the development action which had been damaged by the disaster. So in second and third, this is the dominance of disaster, or you can see I have said that if it is a natural disaster, it is an earthquake. What running in the in the strata, beneath the strata, you don't know what magnitude of earthquake is going to hit at what area at what time, you cannot define. But so your structures that you have constructed with by following the building bylaws or by proper safety, you can very well define. So this first we cannot take into account, but in case of the second and third situation, the development action are influenced by the natural phenomena, and in the first situation that it is the cause is the technical failure. So therefore the difference between the first situation and the situation of the second and third need to be identified and considered. So this difference has to be accessed. This difference has to be accessed because whatever we can control, at least we should go for that control. I have used many technical words because it's something that is related to the technical assessment, like the environmental impact assessment. But what is the need of disaster impact assessment? अगर मैं सीधे शब्दों में बताऊं तो एक नटशेल स्टोरी आप यहाँ से देख लीजिए कि शायद जो आपदाएं हैं वो हमसे ज़्यादा अच्छे से कोलैबोरेट करेंगे. डिजास्टर आर कोलैबोरेटिंग बेटर देन वी आर. जिस तरह हम प्रयास कर रहे हैं, जिस तरीके से हम चल रहे हैं, जिस तरीके से हम अपनी प्लानिंग को इम्प्लीमेंट जिस स्पीड से कर रहे हैं, उससे ज़्यादा तेजी से डिजास्टर्स बढ़ रही हैं दुनिया के अंदर. जो अभी एक यूएन ने रिपोर्ट भी जारी की है जिसके अंदर भी ये चीज़ देखी गई है, डिजास्टर आर इंक्रीजिंग इन ऑल अराउंड द ग्लोब. एंड मे बी और जो प्रोमिनेंट रीज़न निकल के आया वो ऑब्वियसली इन्वायरमेंट linkages ही हैं उसकी. So this is basically the need in the future world about the disaster impact assessment. So we have to collaborate faster than the disasters. Now this classification of disaster, we can again come on to the natural and disaster technological disaster portion. You can see this natural disasters are there, all those disasters like floods and tsunamis and other calamities that are not because of our fault, because of technical faults. And then we have the technological disaster where we can control the design and construction stage and management and maintenance stage. जैसे मैंने बताया कि डिजाइन एंड कंस्ट्रक्शन स्टेज एक हो गई, दूसरा स्टेज हो गई मैनेजमेंट एंड मेंटेनेंस स्टेज. कि अगर आपने स्ट्रक्चर तो बना लिया लेकिन आप यूज करते चले जा रहे हैं. किसी पुल को अंग्रेजों ने बनाया है और वो बहुत अच्छा बना है, लेकिन उसको लगातार यूज करते जाएंगे तो कभी ना कभी तो उसकी सर्विसेबिलिटी ओवर होगी. तो जब अगर आप उसकी डिजाइन को दोष देंगे तो आपने एक्चुअली वहाँ के मैनेजमेंट मेंटेनेंस और मैनेजमेंट पे ध्यान नहीं दिया, उसको ये नहीं देखा उसकी लाइफ कितनी थी. तो अगर कोई डिजास्टर होगी देन इट विल कम इनटू द कैटेगरी ऑफ सेकंड टेक्नोलॉजिकल डिजास्टर्स, राइट. सो दिस इज समथिंग दैट इज एसोसिएटेड विद द क्लासिफिकेशन. और मैं फिर बता रहा हूँ कि जो आप कन्वेंशनल डिजास्टर मैनेजमेंट को पढ़ेंगे तो वहाँ पर यहाँ लिखा होगा नेचुरल एंड मैन मेड डिजास्टर्स, और यहाँ पर आप देख रहे हैं नेचुरल एंड टेक्नोलॉजिकल डिजास्टर. क्योंकि टेक्नोलॉजिकल डिजास्टर ज़्यादातर जो प्रोजेक्ट्स होते हैं उसमें टेक्नोलॉजी को यूज होता है. और कभी कंस्ट्रक्शन की देख लें या फिर कोई मैकेनिकल इक्विपमेंट, इलेक्ट्रिकल इक्विपमेंट इंस्टॉल हुए हैं तो इसके दो पोर्शन हमेशा होंगे कि अगर आपने किसी भी अगर इलेक्ट्रिकल टेक्नोलॉजी की बात करें तो प्रॉपर प्लग लगा के आप किसी सॉकेट में किसी को डाल रहे हो, किसी अप्लायंस को लगा रहे हो तो दैट इज इट इज सेफ. बट इफ the plug is not there and you are just inserting the wires directly, then it is not a safer practice. If you got the shock, then it is the part of this management disaster. आपने गलत डिसीजन लिया, डिजाइन सही था उसका. There we can see this technological disaster can be further divided into the two types. So the disaster that we have previously discussed. So type 1, these are the disasters that are associated with the design and construction, such as setting of design conditions. These conditions are considered at the design stage. Design stage पे अगर कोई गलती है, then it may be probably very dangerous in the future. And type 2 we also have, it is referred to the disaster associated with the management and maintenance of the project. एक डिजास्टर के बारे में मैं एक बताता हूँ कि जैसे हमारा जो डैम होता है, हाइड्रो इलेक्ट्रिक डैम होता है, इसके अंदर पेनस्टॉक लगा होता है. इसमें एक फिनोमेना होता है वाटर हैमर का. अगर आपने डैम को पेनस्टॉक को सडनली क्लोज कर दिया तो एक वाटर हैमर जनरेट होता है जो नेगेटिव सर्ज होती है. अगर आपने एकदम से चलते हुए डैम के पेनस्टॉक के पानी को रोक दिया तो वो एकदम से बैक हैमर जनरेट कर देता है, जिससे पूरे डैमेज जो है वो कंसिडरेबल लॉस हो सकता है और बहुत बड़ा वहाँ पे एक कैलामिटी हो सकती है. और इसको अगर सही से समझना हो, ये डैम की मैंने जो बात की है मे भी कई लोगों को नहीं समझ में आई हो, तो मैं बताता हूँ कि अगर किसी भी नल का टैप है उसके अंदर कोई पाइप को हमने लगाया है गार्डनिंग करने के लिए और वो इतना टाइट लग गया कि वो निकल नहीं रहा है, तो आप कितना भी खींचते रहो वो निकलेगा नहीं. लेकिन अगर जहाँ से वो पाइप कनेक्ट है उसके एंड पर जाके जहाँ से वो पानी निकल रहा है और उसके टैप पे आपने हाथ रख दिया एक बार, तो वो सारा पानी बैक फोर्स से पीछे जाएगा और आपका जो नल से जहाँ कनेक्ट होगा वो तुरंत निकल जाता है. So this is the some phenomena associated with the management practices. Then we will discuss about the natural versus technological disaster. Enough talk is there. I have given several examples too, so I would like to move ahead. And here I would like to just mention this example. And for example, if a rainfall is extremely heavy, बहुत ज़्यादा तेज बरसात हो रही है और जो रोड पर जो जिसको हम पुलिया कहते हैं, कलवर्ट कहते हैं, वो डूब गई है, तो वो इसलिए अगर आपके जो से वो डूबी है तो इसलिए डूबी है क्योंकि उसका साइज सफिशिएंट नहीं डिजाइन हुआ था. इट मीन दैट इट वाज नॉट डिजाइन्ड टू हैंडल दैट मच ऑफ द रेनफॉल. So it cannot handle that much drain that coming due to the rainfall or the volume of the upstream water. And but if this is this will call the situation due to the natural hazard. But if the rainfall is at rainfall normal है, अब rainfall बहुत ज़्यादा नहीं गिरी है, normal है, लेकिन फिर भी जो आपकी कलवर्ट है वो inundate हो जाती है, डूब जाती है, then because of its too small size, then culvert or the disturbed condition, जो culvert के अंदर अगर वो बिना बहुत सारे considerable rainfall के भी डूब रही है, तो उस कंडीशन में हम इसको टेक्नोलॉजिकल डिजास्टर की कैटेगरी में डालेंगे, राइट. अगर सिचुएशन ही ऐसे कि बहुत ज़्यादा पानी बरस रहा है, तब तो कुछ नहीं कर सकते हैं, जैसी डिज़ाइन करी थी फिर भी वो डूब गई, कोई बात नहीं है. लेकिन अगर आपकी फिर कम बरसात है और वहाँ पर प्रॉपरली क्लीनिंग नहीं हुई है उस कलवर्ट की या उस सीवेज की, तो अगर तब वो इनंडेट हो रहा है, देन इट इज विल बी कॉल्ड ए टेक्नोलॉजिकल डिजास्टर. इट विल क्लासिफाई इनटू द टू कैटेगरीज, वन एट द डिजाइन लेवल, सेकंड वन इज ऑन द मेंटेनेंस लेवल. आइदर देयर इज अ मिस्टेक इन द डिजाइन or it will be in the maintenance. Then we also have the key point again, the national disaster, and key point about the technological disaster. It is basic assessment point where whether the countermeasures against foreseeable disaster are reflected to the management plan, usage condition or evacuation plan, etc. इसमें आप evacuate करा सकते हैं और अच्छे से अच्छे आपके management plan बना सकते हैं, इतना आप काम कर सकते हैं. And technological disaster के term में आपके हाथ में काफ़ी कुछ होता है, एंड उस केस में आप डिज़ाइन पर काम कर सकते हैं, मैनेजमेंट में काम कर सकते हैं, एंड यू कैन गो फॉर द फॉर अ सेफर प्रैक्टिस. देन आउटकम ऑफ डिजास्टर इम्पैक्ट असेसमेंट. यू कैन सी this picture is showing that more mitigation means the more savings. This quotation I have earlier used, that $1 invested in the mitigation saves $6 US dollars that save in the future cost. आप पहले तैयारी कर लें और उसके मिटिगेट कर लें, या जब वो आए तब उसको रेस्क्यू करें, तो दोनों के अमाउंट में जो खर्चा होगा उसमें बहुत बड़ा अंतर होगा. सो दिस इज यस मैम.
अवधेश सर, हाँ मैं जरा बस आपको रिमाइंड कराना चाहती हूँ कि टाइम थोड़ा सा.
ओके it's about to end ma'am.
Okay sir, thank you.
Okay, it's about to end ma'am. Thanks for reminding. Okay. So this is another the tale of loopholes. Whatever the discuss with disaster impact assessment, the reality is we are not implementing the environmental impact assessment properly in many parts, and there are lots of controversies are there. So this is something that about the talking basically. Disaster relief is something like this. So the people who are the real sufferers, they are saying that thank God it's a panel of experts. So we should not give them this picture. We should go for the real measures that can help the society. And this we are documenting the things like this, the recipes for the disaster, prescription for the disaster, and disaster waiting to happen. We know everything, but we are not implementing that to that much level, that much scale that are needed basically. And this is the condition of situation in many organizations who are developing who are engaged in the unsustainable development, that they have no funding for the disaster that have not yet to happen. And whatever they are showing, that this type of approach, that we put him in the field but he did not do anything. He is in the field but he is working on the desk. That is why it is not. So these are some global things that we can see. These are some publication like where the EIA and DRR were discussed, and then we see the DRR, those DRR work in other countries in all around, especially in the Sri Lanka, they have a very critical situation. Basically, they are surrounded by the water, and you can see this the number of affected peoples here from 1965 to 65 to 16. So they have implemented DIA in their country in many road projects, road projects. So World and DIA, this was the memorandum that was delivered by the Philippines government for implementing the DRR under HIGO framework. And we can see India is also, this is the report itself. It is the India Disaster Report 2013, in which the point number 2 was the recommendation. Basically, the recommendation for the Uttarakhand flash flood 2013, and it says that for clearances of all hydropower and other mega projects in ecological sensitive regions like Uttarakhand, the disaster impact assessment DIA should be made compulsory besides environmental impact assessment EIA. EIA तो होगा ही, but साथ में DIA के लिए भी recommendation किया गया था इस report के अंदर. So this is some key document we can say that. And at last, I would like to sum up or end my presentation with the word that don't always say there is still time or maybe next time, because there is also a concept of it's too late. So we should not be too late. So with this word, I would like to sum up my presentation. Thank you so much, ma'am. Over to you.
Thank you very much, sir, for such a elaborative presentation. You rightly mentioned about DIA, Disaster Impact Assessment, and its objectives, classifications, and roles, and also its origin. You also described the evolution, how it came into existence. You also stated the need of disaster impact assessment in the developmental projects, and its aim is to reduce the risk and damages due to the disasters. So thank you very much, sir. Our next speaker is Professor Anil Kumar Gupta, sir, HOD ECDRM Division, NIDM. He is a disaster mitigation and crisis management professional. Professor Gupta possesses interdisciplinary expertise with institutional development, coordinated several international and national projects, over hundreds of academic publications, etc. He also served at NDMC, DMI, Nidm in administrative and technical capacities. He is a coordinator of Technical Advisory Committee at NIDM, member of Governing Council and academic or research advisory of several institutions and high-level ministerial delegations abroad. Sir, over to you for your presentation.
Thank you, Silky, and thank you, the entire organizing team. My compliments to the team, and I'll be sharing some of the thoughts here as a speaker. So, is my screen visible?
Yes, sir.
Yes, thank you. So, I have chosen to speak on the second generation disaster resilience. Why second generation? Because we all know that we were undergoing a paradigm shift in disaster management. The paradigm shift is from a response and relief centric approach to more disaster preparedness, disaster prevention, preparedness, and mitigation centric approach. Yes, so we were under that paradigm, and then 2015 onwards we have the Sendai framework. So Sendai framework is an indicative of this paradigm shift, and then 2016 our honorable Prime Minister gave us this Prime Minister's 10-point agenda on disaster risk management. Very interestingly, this new thought process was already going on, and then we had this a very different kind of disaster that started as an environmental emergency, then turned into health emergency, and then became a global disaster that we call it COVID-19 pandemic. And this disaster is of disasters, because during the pandemic, not only one disaster, but various other disasters also came during this disaster. So that lesson that how we have to deal with the risk of a number of disasters at the same time, and then how our journey from disaster management to disaster risk reduction, then disaster risk management, and now to disaster resilience. So why resilience? Resilience is basically the ability to bounce back after the stress is over. So that is important because we all have to agree that we cannot bring down disaster risk to zero. So that is why I recall the book called Living with Risk. UNISDR in 2004 published a book called Living with Risk. It means we cannot bring down all risk to zero. So we have to learn to live with risk. And on the other hand, I always say that live with nature, because if you live with nature, it will help us understand how you live with risk. So that is kind of a important thing. This COVID-19 pandemic, if we look at the COVID period, because still we are not having this post-COVID. I thought that COVID pandemic will be over soon, but almost 10 months, and still we have some more time to go. What is different here as compared to other countries, and what is different in this pandemic? So this pandemic is, there were several pandemic in the past also, like bird flu was there, swine flu was there, Ebola was there. But this pandemic is different. This pandemic is different because more than 150 countries of the world has been affected by this coronavirus pandemic. And beside this, India is also different in many ways. Like we have large population, we have poverty, we have migrant workers that we had seen during this lockdown. Then we have a number of types of disasters, like multiple disasters. We have all kind of disasters in our country, in fact. You name a disaster and we have it. Then we have a varying type of climates. We have 21 agroclimatic zones in the country, and cultural variations are also very significant. You move 100 kilometers and you'll find a different culture, and even dialect will also change. So this is the kind of a peculiarity of our country. But despite of all odds, despite of all diversity, we tried to join hands and make efforts in dealing with this disaster. Although there were some kind of a lapses also, because this was the first time that we had to deal with this different kind of disaster. So that this experience was not there. What are the new lessons that have come for us in this disaster resilience phase 2, our second generation disaster resilience? The Sendai framework itself, in its preamble, given emphasis on health services or health system. But despite of that, in many of the developing countries, the focus of health has been more on curative approach, or more on treatments. That if some ailings are there, how fast we treat, how we improve our hospitals, how we improve our health systems. Yes, that is very much required. But the awakening over past one decade or so is more on holistic health. That health is not only treatment. Health is basically that how we prevent the health issues, how we prevent illnesses or ailings. So that is important. And that is why the issues of community health has become at the forefront. And this community health, other terms, we call it environmental health. We also call it preventive and social health. There even psychosocial issues are also coming into there. Then disease outbreaks, epidemics, all are coming there. So this issue has emerged as a very, very important dimension of disaster management. Recently, we have released a book on lessons from coronavirus pandemic. That is a global publication by Springer Nature. And there also the lessons that we have identified, that we need to invest a lot in improving our health system resilience. And health system resilience cannot be improved only by the health department, but a very efficient integration with the coordination with other sectors would be required. For example, if hospital is intact and hospital is good, but patients need a good road network to reach to the hospital, or the doctors will need transport system to reach to the patient. And then hospital will need electricity supply, hospital will need water supply, hospital will need waste management systems, hospital will need So many other subset facilities, for example, the storage cold chain facility for storage of the vaccines. So these kind of things call for other sectors to come forward, and there, in fact, the role of science, technology, social sciences, and management together becomes very important. Then, as my deliberation started with how the COVID is different and how India is different. So here, what we seen that during the COVID-19 pandemic, we also seen that institutional resilience is very poor in our country. Most of the time we have been focusing on emergency response, but how the institutions and businesses, industries, organizations are ready to deal with to face this situation of disasters, that there is a question mark. For example, more than 70% of the industries in the country did not have any business continuity planning. And even with the industries which had business continuity planning or business continuity management system in place, never had included disasters or environmental emergencies as major impediment to the businesses. Whereas it is very important dimension. If we take example that in Lucknow also, there are 2 weeks or some even a little more days of fog situation that disrupts your transportation and public life in Lucknow also. And sometimes some of the accidents are also reported during the fog conditions. I also myself witnessed that because of the heavy fog, that is one kind of environmental emergency, Jammu Kashmir highway, there are a number of accidents are reported. So how environmental emergencies and disasters are causing impediment to businesses, causing damages that need to be integrated into overall business management practices also. Then agriculture forms major part of economic development, but in economics, hardly 11 or 12% of GDP, we say that it is because of agriculture. Because we are not able to encompass other agriculture dependent occupations. In fact, I would say that more than 24 or 25% of livelihood in India is supported by agriculture or agriculture related interventions. Agriculture is not only what is produced on the farms, but a number of industries, number of businesses, number of trade that depends on agriculture and food processing. So any person who is associated with this kind of thing is dependent on this. This is although that this picture of the data shown of May, and then the latest data of October, the second picture is of October. This picture I have chosen to share here, that very interesting dimension. It shows that wherever we find that the coronavirus cases are highest in numbers, very interestingly, these are the highly developed states of the country. So just a question that how the highest developed and highly industrialized states of the country, highly urbanized states of the country, and there this pandemic is also in the highest effect, including Delhi, Gujarat, Maharashtra, Andhra Pradesh, Tamil Nadu. So these kind of things. So that puts a question on our paradigm of development, on our protocols of development, and that is why now I say that and when I say business does not mean that only profit-making business. Even an NGO, even an academic institution, even a government office, even industry, even any panchayat office, business means some kind of endeavors that we are continuing. So, for example, the vehicles plying on road, so that is a kind of a transport business. So when I say business, it needs to be to integrate disaster risk management and the business continuity management need to be improved to integrate this. So these are the kind of things that have emerged, and now I am talking recently, just today also I was talking to more than 450 delegates under FICCI, and I was talking to them that how their business units need to integrate disaster management, and they need to develop a disaster management plan. And in the inaugural of the training also, I was asking that the educational institutions should also think of developing a disaster management plan. So these kind of things are now emerging as an important dimension. But when I say disaster management, then sustainability cannot be left alone, because all the institutions need regular supply of water, regular supply, waste management, then ecological number of ecological services. So how we integrate this environmental conservation, our environmental practices, then land use related issues, then disaster management, and then health related issues. So this is a new regime where actually so many things are now combining. There was a time that climate change was a different subject, environment was a different subject, disaster management was a different subject, civil engineering was a different subject, social sciences was a different subject. Now, in fact, in disaster resilience, we have to integrate all these subjects, because no one subject can give you the complete picture of disaster resilience, because we have behavioral dimensions, we have gender issues, we have child rights. So these kind of things are also emerging within disaster management also. Now, agriculture within this coronavirus pandemic, we also saw that how agriculture has been affected, agricultural supply chain has been affected, but now it is reviving. But many of you might have noticed that many of the people have undergone the change in their food habits. So if the food habit is changing, certainly agricultural practices are also going to change. So how our farmers are going to adapt to that, and particularly when there was incidences of lockdown and the restrictions on transport and travel, then already there are droughts, floods, and these kind of challenges with agriculture. I was talking to Mr. Ashish Panda in the morning also, that even the human animal conflict also lead to impact on the agricultural practices in the states like Jharkhand or in Chhattisgarh. So how agriculture is affected by multiple kind of disaster risk. India's notion of improving farmers' income, that we say doubling farmers' income, are the ease of living of our farming community in the country, that we say that we have to achieve by 2024. How we are going to enable like the kind of a diversification of the minimum support price, or they're taking all the farm produce from the farm itself, because 70% of worry of Indian farmers is not actually producing agriculture, but after the agriculture produce is ready, after the harvest, what to do after the harvest. So recently we have been working with Indian Council of Agriculture Research, that how post-harvest management is facing challenge by disasters, and how that can be improved. Because some of you might recall that 3 years before, the farmers in Madhya Pradesh and other parts of the central India, they committed suicide when it was a bumper crop. So when there are a very good crop, then also farmers committing suicide. When there is a bad crop yield, then also they are committing suicide. So there are some kind of a management issues. So we need to improve that, because there are issues of perishability. We do not have a disaster resilient storage system, disaster resilient food processing systems, and many of the food produce is spoiled before it is put into use, or before it is taken to the safer storages. 10 minutes. And then very interestingly, this coronavirus pandemic also gave a lot of environmental lessons. And that also, I thought that I should discuss that. We saw clean air, very clean air. But now we are seeing again, the coronavirus is still here. And now we are seeing the air pollution episodes in Delhi and some parts of the Punjab and Haryana. And in fact, mask is becoming compulsory, not only for coronavirus, but also because of air pollution. And we had very serious poor quality of air nowadays. Even today also the atmospheric quality is bad. And 2 years before, you recall that the Delhi had to declare the health emergency because of air pollution. So variations, we had seen the very pure air, very clean atmosphere during the coronavirus period, but we are seeing the bad quality air also. Similarly, the water pollution also, we had seen Yamuna like anything, it was so clean for some time, then again it is again unclean, and it is again dirty. So these were kind of even the wildlife started walking on our streets. So there were also the kind of theories that may be because of the lack of noise, because noise had reduced, ambient noise got reduced to a very significant level, and because of that also the animals moved to urban areas. So that was also the kind of lessons, and very good research papers also coming nowadays on these dimensions. But in waste management, there were two observations that I made. One is that when we were supplying food to the migrant workers and so many people, yes, that was a selfless service people were doing, NGOs were doing, government was doing, and supporting the people who were homeless or who were coming back from their location of their employment to their native villages. But what was the waste management? All that plastic waste material has gone into environment, and that is going to create future risk. Because plastic is non-biodegradable, and that is causing even the risk in hydrological regime also, and then there are challenges. But on the other hand, a new kind of waste in huge quantity also started generating, that is the biomedical waste. So that is why the Central Pollution Control Board was required to develop and issue a specific guidelines for dealing with COVID waste, or the hospital waste in the coronavirus pandemic period. So these kind of things also evolved, and huge quantity of waste has been generated. Even the issues of discharge of a huge amount of sanitizers, other chemicals, detergents and soaps in our sewage. So that caused additional load of surfactants in these water bodies. Then there were also incidences of number of disasters that took place during this coronavirus pandemic period. Two major cyclones that we seen. Cyclone Amphan was a super cyclone. Cyclone Nisarga was also a devastating. So it was disasters within disasters. So we can say that kind of phase of complex emergency. And number of chemical industrial accidents also we saw. That Visakhapatnam gas leak, it was many deaths also took place. Then Assam gas leak and oil plant explosion took place. This is the picture showing that how ecosystem services, how various lakes and ponds were affected by in the route of in the state of West Bengal and Orissa because of cyclone. Yeah. Then it is kind of an impact on various biodiversity systems and ecological services. Then impact of on the agro ecosystems. So how just see that how the agricultural systems got damaged, and lot of plantations and orchard and fish ponds got destroyed. Then again, this within this coronavirus pandemic period, we also had a different kind of disaster. That was a locust attack. It affected more than 10 states of the country, and some 4 or 5 states were badly affected. And first time, the kind of intensity and the coverage of this locust attack is so serious. So this was again a new kind of disasters within this disaster. This is the picture showing that how it affected some national parks and wildlife sanctuaries also in some of the states. Then this is a picture showing the damage by Assam gas and oil leak, how the biodiversity and fishes got affected. These are the locations of the biological parks got exposed to this this damaging impact. Then effect of Assam floods on biodiversity hotspots. Then this is Uttarakhand fire. So see, this coronavirus period, the type of disasters that we've seen, it's really a great example to see that it was not only one disaster, it was a number of disasters that took place within this period. And it's such a devastating scene of this year only. This is the real, this is picture of Uttarakhand. So what are the lessons that we need to be more holistic in disaster management, and we need to look at the complete crisis cycle or the complete disaster management cycle, not only the emergency response phase. If we do not take care of the risk, how the risk is built up. So that is important. For example, faulty land use. Basically, the things start from there. And what many times what happens that at the beginning we do not care. When we get a low-lying area filled with silt or filled with garbage and then converted into beautiful sports ground or beautiful park or mela ground, we feel very happy that okay, nearby our home we got a mela ground. We will have a good Ramlila, or we will have some gathering or something good, or we'll have a good park. But we do not notice that actually that the natural flood control site that was in the form of low-lying area or a wetland, that has been lost. And the next time, whenever there will be heavy downpour, that all the water is going to enter into our houses. And that is what is happening in Bangalore, that is what is happening in Surat, that is what is happening in Chennai, that is what is happening in the part of the Lucknow also. Delhi, of course. So Mumbai, every year Mumbai is getting urban flood. So why urban flooding is becoming so recurrent? So these are the kind of issues to think. And then we are continuously degrading our ecosystems without thinking that what are their ecosystem services contributing to disaster resilience. So probably we need to have more integrated approach of sustainability and disaster resilience. And then we also look at that it's also a business. Business means whatever I do towards some kind of a productive outcome or some kind of a supply of services or amenities, that is also a business. So we need more integrated approach, and we also look at that how the infrastructure need to be more resilient. India has taken a global lead for establishing a global coalition for disaster resilient infrastructure, CDRI. So that is also a very good initiative. And we should not forget that our villages are transforming to cities. Very shortly, by 2035, we say that more than 50% of the population will be in cities. And I say I think that by 2030, not only 50%, even more population, because our rural areas are also transforming very fast. It may be someday when there will be no actual village. All the villages, or even if the name is village, but the village will be converted to town kind of thing. So how urban resilience has to be put into place, and then how we are going to protect livelihood. I was discussing with a new channel today in the morning, and then issues of livelihood challenges following the cyclone that is taking place, that is going to take the landfall shortly after a few hours in the state of Tamil Nadu and Puducherry. So how these things are evolving, and most of the time our focus is on immediate relief, but livelihood is not an immediate thing. We cannot restore livelihood in few days time. If their fish ponds are destroyed, if the telephone lines got disrupted, if the road network got disrupted, if so many kind of consequences which are of medium term and long term also. So that is there. Then greening and carbon neutrality in relief, that is a new domain that globally now we are discussing, that how our disaster response can be more sustainable. For example, many times for alternative routes, we immediately cut the trees and create new road. That often happens because we are not prepared, or we are not putting the plan in practice. If we know that what are the all possible routes without minimum ecological damage, so we will be able to reduce the future risk also. Now we are also talking that how we more our construction or reconstruction more energy efficient, more material, how we optimize the material requirement, and then how we use the locally available material so that we can reduce the carbon footprint of these kind of activities. So in Uttarakhand, we have been working on these dimensions. We are also looking at that whatever tools are available, for example, post-disaster needs assessment, risk assessment, or environmental impact assessment, a tool that is called life cycle assessment. And now we are trying to look at that how life cycle assessment can contribute to reducing the risk of disasters in the entire cycle of any kind of a product. For example, when I say steel, so steel is not only the life of steel starts from the iron ore. So basically iron ore mining to then we take it to they smelt processing, where smelting is done, and then the steel is made, then that goes to foundry, then it is put into use, fabricator, then it goes to fabricators, then from fabrication it goes to use in our houses, then it goes to kabadi wala, then it goes to final disposal or recycling. So, and each and every step, there is some kind of impact on environment, some kind of impact, and then some kind of, and therefore some kind of contribution or to disaster risk also. So whether it is contributing to aggravating risk or reducing the risk. So this is a new concept that we are discussing. Then long-term resilience. So resilience should not be only for our our generation, when we are discussing about disaster resilience, we should also look at the following generations. For example, we are going to be replaced by the new generation very shortly. So how we are leaving the disaster resilience in place for the future generations? So that calls for integrating sustainability regime also, and then also looking at the opportunity. So whenever a disaster takes place, that gives us a lot of lessons. Health sector, I already mentioned. Recently, we have contributed the National Health Adaptation Plan of the country on the request of Ministry of Health and Family Welfare, and WHO has also supported us. And there actually we have given focus that the health infrastructure and health facilities, even at the sub-center level, center and sub-center level, need to be made disaster resilience and climate resilience, because that is the fundamental thing. Many people are migrating to urban areas thinking that the cities have better health facilities. If we improve health facilities and if we make disaster resilient our health facilities in the rural areas, there will be also that this will help in curbing the migration from rural areas to urban areas. And we need to similarly we need to make other infrastructure also disaster resilient. Beside this, when we talk of resilience, we also talk that how one infrastructure is depending on other infrastructure. So what is the relationship between each other? So that is important, because I say that if hospital is intact, but if the road is washed, so how the doctors will reach to patient, or how the patient will reach to the doctor, or how the medicines can be brought from other town to the hospitals. So these are the things. Without electricity supply, hospitals cannot run. Without water supply, hospitals cannot be functional. Without waste management system, hospital cannot be functional. So other infrastructure systems are also contributing. So there is an interdependency. So we need to look at this also. So there is actually a lot of things. This is already I already discussed that how integrated mechanism of risk management, adaptability, or resilience and sustainability need to be put into place. Resilience is the ability to bounce back, and then sustainability is basically looking at the kind of a future scenarios. What can happen after 10 years? What can happen after 20 years? But why it is important? Because if we are constructing a house, we are not constructing a house for 2 years or 5 years. We are constructing a house for us. We are constructing a house even for our next generation also. So that is the reason a disaster resilient has to be the intergenerational equity also has to be there. And there are also kind of a very interesting thing, and see the kind of a waste generated. This is a picture showing waste generated, and this is just a how we put reconstruction and mitigation in place. So like this is this was a chair, and the disaster has disrupted, and this is a rehabilitation. So why rehabilitation should not be correct focus, but the correct focus should be reconstruction. And reconstruction, when we say that built back better. So just see the picture. This is a jugaad type, and this is a kind of a more robust and more resilient. So whenever we construct after a disaster, so even we construct if we construct lesser number of houses or lesser number of rooms, those should be more disaster resilient. So we should not recreate the risk. So that is also a thing. Then just coming to that, what our Bapu Sri Mahatma Gandhi ji told, that earth has enough to satisfy the need of the people, not the greed of the people. So this also very much reflects that we need to bring our the impact of our activities on environment to a limit, and that limit which we can manage. So we can say that manageable impacts. For example, when we are working, so if we have 8 hours of working or 9 hours of working, maybe once in a week we can work for 12 hours of working. But all 6 days or 7 days, you cannot have 12 hours of working. The pressure you cannot then sustain. So similarly, it is the environmental system also. If we continue exerting additional pressures, then there will be a kind of a bounce back. And bounce back, in the other form, we call it the ecological backlash. Backlash is like a boomerang effect. So if we continue creating pressure on the environment and ecosystems, it results in the form of some disasters. So that is interesting thing. Then there are different kind of conditions of sustainability, like environmental sustainability, economic sustainability, social sustainability, and also human well-being. And there has to be a balance. When we talk of sustainability, there has to be balance between all the components of sustainability, as reflected by the 17 the set of 17 goals of this SDGs. And very interestingly, if we look at 17 goals of SDGs, the many of the goals are related with climate action or poverty, like zero hunger and these kind of things are there. And also the environment, for example, climate action, life below water, life on land. So these things are very important, and that is why now within the disaster management regime, we are also talking of that how compassion is an important dimension of disaster resilience, and particularly care and protection of animals. So because for quite a long time our focus has been on protection of human being in disasters, but care and protection of animals. And when we say animals, it is wildlife, it is livestock, it is our other pet animals, and it is even stray animals. So all kind of animals, even the trees, plantations, and microorganisms, because the sustainability depends on the proper relationship between between living and non-living things. So these are very important, and that therefore we need to align our disaster management activities with the goals of climate change mitigation, that now we say that nationally determined contributions are NDCs, INDCs, and the sustainable development goals. Okay. किसने दिया? मैं दूसरे मीटिंग में हूँ, बोल दो वो कालू कर लें वो लोग, ठीक है? So this is just a glimpse that very frequently we find that our cities are facing the challenge of water. For example, there are discussions about the Cape Town, the dry city going to be dry in this Africa, and then Chennai, which had a major flooding in 2015, but 2016 was a major drought in Chennai. There is no water. So how the cities are facing challenges like this, that the same city that face a major flood, after a few days or few months, it faces drought. So these kind of things are there, where water is becoming a central point, but things are, the SDGs are also linked to each other. So no SDG can be dealt separately. If we really want to achieve SDG, we have to take into account the interrelationship between various goals of various goals under the SDGs, and also relationship between achieving the goals of Sendai framework for disaster risk reduction. This is a common picture that I like to show to my participants, as this is a fundamental question of the life, because when we talk of the balance between nature and materialistic growth, so it also calls for some kind of a thinking, for some kind of a balance between materialistic growth and spiritual growth. And because peace and prosperity we cannot achieve without the spiritual growth. And this spiritual growth calls that we review our developmental race. And this is what, when I say spirituality is not necessarily a religious kind of a call, but it is rather a scientific call, or it is a developmental call, because we need to really think that what really we want. What happens that if we own a 2-bedroom flat, then immediately we start dreaming for a 3-bedroom flat, and then we once we get 3-bedroom flat, and we start dreaming for a 4-bedroom flat, and then by the time we own a 4-bedroom flat, our children are already grown and they are ready to leave the house. So by the time we have a bigger house, there are only 2 persons to live in that house. So where actually we are heading? So we have to look for that what is really important. Whether a smaller house with full safety, a disaster-proof housing, that is important, or a bigger house which is prone to disasters, that is important. So just a clue, there are several other dimensions to think on that whatever is space of development, whether it is a dimension of land use, whether it is a pace of going multi-storied, whether it is a pace of going developing our real estate buildings, are so in the low-lying areas, are degrading our mountains and coastal areas, constructing so many houses. What actually really we want to do, and why this is important? Because this is again the second question that I asked to my participant, that have you ever seen any definition of development? Avdesh ji is listening to this question for past 3 months, and I still ask that if anyone got a question, a definition of development anywhere, please share with me. I will give you a silk chocolate. So there is no definition of development. We have the definition of inclusive development, we have the definition of sustainable development, economic development, we have वो सब है, but alone development का definition कोई नहीं. तो हम लोग किस चीज के पीछे भाग रहे हैं? We are running for after something whichever is not defined. तो किसी के पीछे भागना है तो it should be defined ना. So that is a fundamental question. So that is a kind of a point to think that we need to think actually हम कौन सा development चाहते हैं, and if we are really able to work on that, we automatically will start thinking of safety and resilience into our developmental systems, because that is the real requirement, and that is the difference between Indian constructions and the construction in Japan. Constructing a house in Japan is very costly, because even a smaller house should have all complete safety system. It should be disaster proof, though only then you are allowed to dwell into that. Not only that, here you just call a panditji and then second day you can dwell into that. So there it is not that. The government agency will come, will inspect, and then it will authorize you to dwell into that, then only you can dwell. So this is the kind of thing that poses certain question. This is the development in the books of biology that we find the definition of development, which is not their thing. But here also there is something in between adult and egg. There is an inevitable component which is not mentioned here, that is death. So what is there? So if we start looking at from the angle of spirituality, that we need to introspect that what actually we are running around. If we are into blind race of development, then destructions are inevitable, and that is what is happening. We are constructing so many buildings. You go to any kind of road after 6 months and you will find that new buildings have come up. How many of those buildings are actually earthquake resilient? How many buildings are actually resilient to the wind storms? Like if you look at Noida, Greater Noida, Gurgaon, Ghaziabad, yeah, within 2 months, 3 months, you are getting new projects coming. Everywhere new buildings are coming. So that is posing a question. And that this question is also relating with kind of our visualization of the development and the dream, because most of the time we have been trying to copy the American living, that they have very good infrastructure and they have this living and that living, their GDP is very high, and see what is happening. The biggest democracy, one of the biggest democracy, and past 1 month there was fight over the presidentship, and the kind of fight that we used to have in our sarpanch elections, the village elections. We've seen that they're national elections. But anyway, that put that as a joke apart. But talk of the economy, very interesting report. Just see the title of this report: Illusion of Growth, and that has been proved in the coronavirus pandemic. Globally, the biggest economies have gone down. Biggest economies. Even they had the best health infrastructure. France, Germany, they had the best. Italy, they had the best health infrastructures. They could not protect their citizens from coronavirus pandemic. The world was ready to fight using nuclear weapons, and a virus which you cannot see has destroyed the economy. So see, we have to accept the power of the nature. And nature is nothing but the other form of God. So whether we believe in God or not, but we have to believe in nature, and that is why the report that is called "Live with Risk" or "Live with Nature" is very important, and that is why I call that now new urban development, now new regime of urban planning is basically that how we protect the natural resources in our cities. That is also equally important. 20 years back, our cities were being planned thinking that now we don't need the lakes and ponds in cities, we don't need trees in cities. Now there is a different kind of planning, and this is very interesting that this report says that American dream is over. That has been proved. This is also showing that on one hand, this consumer credit is growing. in US. This is again why American dream is over. But on the other hand, people's purchasing power is declining. So, and this is an interesting picture. So we all are within this now. हम सब लोग कंप्यूटर में घुसे हुए हैं, लास्ट वाली स्टेज के अंदर हैं. हम कहाँ से चले थे? फ्रॉम वेयर वी स्टार्टेड इन ह्यूमन इवोल्यूशन. हम सीधे खड़े हुए, इसके बाद वापस से अभी कंप्यूटर पे आ गए, और अभी अगले 10 साल में हम कहाँ जाएंगे वो भी पता नहीं है ना. सो वी हैव टू रियली सी कि इसके बाद कहाँ है. ये पिक्चर यहाँ तक की तो मिलती है, व्हाट नेक्स्ट. तो इसके बाद मुझे लगता है कंप्यूटर खड़ा होगा और हमको चलाएगा, है ना. तो मुझे याद है, पूरी कविता याद नहीं है, बट मेरे एक प्रोफेसर थे व्हेन आई वाज इन यूनिवर्सिटी, प्रोफेसर CD सिंह. वो कोई कविता सुनाते थे जो कहते थे, वो दिन कब आएगा. उसकी 2 ही लाइन मुझे याद हैं. वो कहते थे, वो दिन कब आएगा जब प्लेटफॉर्म चलेंगे और ट्रेनें खड़ी रहेंगी. वो दिन कब आएगा जब आदमी जलेगा और सिगरेट उसे पिएगी. मुझे सिर्फ दो लाइन याद हैं. तो वो मुझे लगता है कि शायद ऐसा दिन आ सकता है. इसलिए वी हैव टू बी मोर कॉशियस. We have to plan more proactively, we have to think more proactively, and we have to develop good case studies that how do we sustain, you know? So that is important. Otherwise robot आपको बताएगा कि आपका खाने का टाइम आ गया है, अगर आप खाना नहीं खाओगे तो आपका बटन ऑन करके आपको खिला देगा. So this is about the various ecosystem services that we are not talking about. That is an outcome. This picture is taken from the outcome of the Millennium Ecosystem Assessment, that how the various ecosystem services are contributing to sustainable development and disaster resilience. Like I gave the example of the values of wetlands are the lakes and ponds. Wetlands are the natural flood control sites, but they also contribute in drought resilience. They also contribute in our moderation against our mitigation against the brunt of heat waves. And beside this, they provide a lot of other services, for example, recreational services, cultural services, you know, and biodiversity services. So finally, coming to the end of my discussion, as when I talk of spirituality, I use the synonym as nature, because nature is spirituality. Going close to nature is going close to spirituality. So we have to have a balance between. We cannot live without materialistic development or infrastructure development. We need to have, but how we redesign our infrastructure growth, how we redesign our materialistic growth, so that our life is sustainable, human society is sustainable, and we have better resilient development. So this is the concept of middle path, and I quote here the teachings of Lord Buddha, which said that we have to live with this world, that we have to maintain, we have to manage a balance between our various actions. This is just a glimpse about the Indian ancient knowledge. Not only Indian ancient knowledge, most of the countries, if you look at the ancient literature, you will find that this kind of knowledge is available across all the religions, across all the languages, even in Quran also, even in Bible also, even in the literature of Jainism and Buddhism also, we find a lot of literature that gives us a lot of lessons. So how we blend traditional knowledge with modern science, so that is also a very important dimension, and that actually will give us the clues that how we move on the path of this middle path that has been prescribed by Lord Buddha. Thank you very much for inviting me to share some of my thoughts, and let us pray that this coronavirus pandemic is over soon, and we move to normalcy. But yes, whatever lessons we learned during this coronavirus pandemic should not be forgotten. That is very, very important. And I would urge research scholars and faculty members to publish more and more good case studies, not only about science, not only about purely about the emergency response, but even human values and ethics, that how the new definitions of human values and ethics have emerged during this coronavirus pandemic, and what are the new dimensions of this compassion, what are the new values of this new approaches. For example, now there is going to be touchless system. We are and very shortly we will be more and more automation and robotics. So how we are going to have to deal with those requirements. For example, the last word, we have been talking about the human rights, then started talking the women rights, then children's rights, and then now we are talking globally about the gender rights. I was talking to Mr. Ashish Pandaji, and it's not very far that we will be required to talk about the robo rights, because very shortly the robots are going to be the part of our life. So with this, thank you very much, and I close my talk here. Thank you. Silky, you are mute.
Sir, I just unmuted. Okay. Sorry. Thank you very much, sir, for this amazing presentation. And the lessons you have put forward are as such that we have to inculcate all the DRR practices together in the businesses, all the sectors of businesses, and that there is, because there are interdependencies, and this pandemic has taught us the need of inclusion of DRR in all the sectors, especially when the situation of disaster within the disasters we are facing, such as we have observed Amphan, Nisarga, and floods, so many floods in these 10 months of period of pandemic. And also you rightly said that there is a need of different approach to handle multiple emergencies as well. Thank you very much, sir. Now I request Dr. Meenakshi Singh, Associate Professor Chemistry, to take over the next session and next session's proceedings. Over to you, ma'am.
Thank you. Thank you, Ms. Shilki, for coordinating the first session so well.
Thank you.
A very warm welcome to all the participants present. Welcome to the valedictory session of the 3-day training workshop and faculty development program on disaster risk reduction. We are very grateful to Major General Manoj Bindal, Executive Director, NIDM, for approving the proposal and providing us this opportunity to create awareness among the students, faculty, and the parents. On behalf of Isabella Thoburn College, I extend a warm welcome to Professor Anil Gupta, Head, ECDRM Division, NIDM, and Mr. Ashish Kumar Panda, Consultant and Faculty Member, ECDRM Division, NIDM. We are grateful to both of you, sir, for giving this insight of integrating disaster risk management and reduction with the curriculum, and it is our responsibility to extend knowledge and awareness beyond the boundaries to the society. It gives an immense pleasure to welcome Dr. E.S. Charles, President, Isabella Thoburn College, Dr. V. Prakash, Principal, Isabella Thoburn College, who are always there to encourage, support, and guide us. Working with them has always been a new learning experience. We are highly grateful to all the eminent speakers, beginning from day 1 to day 3, for enriching us through their very informative deliberations. A special thanks, of course, to all the participants present, as your presence made this program a great success. Now, I invite Mr. Ashish Kumar Panda to kindly summarize the proceedings of the 3-day program with our participants. Mr. Panda.
Sir, kindly unmute yourself.
Thank you, ma'am. It was really a wonderful endeavor on part of NIDM and Isabella Thoburn College for having this 3-day important faculty development program as well as this training workshop. So briefly, I will summarize what we have gone through in the last 3 days. The first day, we had 3 important talks, rather 4. We covered the sensitization of COVID-19, the global Indian context, the importance of lockdown, home quarantine, various protective guidelines issued by Government of India, then post-COVID scenario, what we have to do, we have to de-stress ourselves and things like that, and the pathways for future concern and care. Then we learned about the basics of disaster management with details about increasing disaster scenario in our country, terms of various terms like hazards, risk, vulnerability, capacity building, paradigm shift in disaster management approaches, the global documents of SFDRR, SDGs, and Paris Climate Agreement, our own Honorable Prime Minister's 10-point agenda on DRM. We talked about institutional mechanism, then various agencies like NDM, SDM, DDM, NIDM, and DRM, and things like that. And we ended with the emergency management plan framework on that topic. Then we learned about the ONGC operations across India, especially the offshore basins where disasters occur most prominently, the operating area, and many terms, terminology like base stations, control room, offshore activities, helipads, drilling platforms, and the kind of situation the officials, ONGC officials, they are working over there, the corporate risk matrix they are working, the severity and probability rating that they are following, the emergency response plans and their implementation, the regional contingency plan, corporate DM plan, and oil spill management and things like that. And the last talk of the first day was on forest fires in India, the anthropogenic regions and types of fire, the fire triangle, fire dowsing mechanisms, the indigenously built instruments and equipments by Silviculture Division of the Forestry Research Institute of India, and mitigation measures they are doing, then all the proven mechanisms world over to fight fires, and need for forest fire research centers in India, need for strengthening communication, monitoring mechanisms, and need for awareness for the rural masses, etc. On that topic. The first day was very important with respect to the competitions that your college organized for students with respect to poetry competition, collage competition, and just for 1 minute competition. So wonderful presentations we had there. New ideas were given by the students of the Isabella Thoburn College, and we had wonderful deliberations on important aspects of disaster risk management. The second day, we touched upon important aspects of disasters, its management, then extinction of life on Earth with respect to biodiversity, then global vulnerability profile, the loss of biodiversity due to disasters, role of biodiversity in ecosystem functioning, its linkage to our own existence, then interdependency of species, impact of floods, droughts, cyclones on biodiversity. Then Mishilki spoke about the nature-based solutions for biodiversity conservation, mangroves examples she gave. Then she also correlated the Fani and Amphan cyclone with respect to biodiversity conservation, and also eco-DR practices in this regard. Then we learned about chemical disasters and their risk reduction, and ma'am briefed about the Indian chemical industry scenario, the major accidental hazard units, few examples, chemical accident examples of Visakhapatnam chemical blast, then chlorine leak of Mumbai port, then Bhopal gas tragedy, then observations what went there and what went wrong, and lessons learned from those kinds of incidences, and the failure of man and machine, human error, lack of emergency plan, inadequate equipment and response, and lack of information, uncoordinated evacuation plan, etc. Then she also talked about the safety data sheet, transportation of hazardous chemicals, then rules and regulations and acts that those are prevalent in our country with respect to how to take care of chemical accidents in our country. Then the last talk of second day was on community capacity building, specifically in the times of COVID-19, and community being the first responder, self-regulation, self-preparedness, which is important for any kind of unexpected event. And we learned then how we have to be ready always, then failing to plan is planning to fail, then community-based disaster preparedness. Then Dr. Sanjay spoke about technical and functional capacity, core competencies of capacity building, our personal preparedness. Then specifically he talked about the disaster management kits, the Go kits, he says that, which is relevant for 72 hours survival in a post-disaster scenario. He also talked about, he said that at the same time, we need to give special attention to the disadvantaged groups of our society in our community preparedness plans. So day 2 ended with very important portion of our program, that poster competition on various ideas on disaster risk management by faculty members, esteemed faculty members of Isabella Thoburn College. Great effort by all of you people, and it was a wonderful experience. Today, we covered 3 important topics with respect to psychosocial care, its need, the what, the why, and how of the mechanisms of catering to the need of impacted community in a post-disaster scenario, its evolution in the last 2 decades, the gap areas, issues, and challenges we covered, then lack of experts, training and capacity building, lacking and standardized tools, lack of documentation, research and development needs, then financial needs, the lack of long-term planning, etc. And also new today that National Mental Health Program is there, then Mental Health Care Act 2017 is prevalent in our country. Then government has also come up with mechanisms of Bharosa, Manu Darpan, and Kiran kinds of initiative by several central and state government departments. Then Avdesh ji spoke about DIA, the overview about it, the relation of Lucknow and Bareilly. That was a wonderful portion of his presentation through Madam Isabella Thoburn and Dr. Clara Swan. Then he spoke about atmosphere, lithosphere, hydrosphere, biosphere. Then several disaster incidents. He gave examples of World War I, the Hiroshima Nagasaki incident, then Chernobyl nuclear disaster, our own Bhopal gas tragedy, our tsunami of 2004 and Kedarnath tragedy of 2013, the need for DIA with respect to SDGs, sustainable development and disaster resilient society kinds of concept. He also spoke about the role of DIA in defining risk and anticipate damages, pre-feasibility study, actual design, and he also gave examples of few countries like Sri Lanka, Philippines, and India in this regard. Then came Professor Anil. He talked about future disaster resilience today, COVID-19 lessons for second generation disaster resilience. We need to learn to live with risk and live with nature. That was his message. The need for safety culture in DRF framework in existing weak health system of India. One important aspect he covered, the institutional resilience and business continuity planning with due safety audit and agriculture sector resilience and recovery, rural health issues and pressure on rural resource systems. He also spoke about the recently developed National Agricultural Development Plan, and we are also working on National Health Adaptation Plan. He spoke about the disaster resilient food processing system, environmental impact of pandemic, waste generation, including biomedical waste. He highlighted the various disasters that took place during pandemic and multi-hazard scenario that we are living in, and intersectoral and holistic approach that is required to deal with all these kinds of disasters. So basically, the message he gave was, can disaster risk be translated into opportunities? So having summarized the programs that took place in the last 3 days, so this 3-day program has been a very satisfying event. On personal note, with respect to knowledge dissemination, information gathering, and wonderful presentation discussions on various important aspects of disaster risk management. I thank all the esteemed speakers for their valuable time, expertise, and commitment for this program. I also thank all the wonderful participants who gave their full support, time, attention to this 3-day program. Thank you so much.
Thank you, sir, for summarizing the event so well. Before we proceed further, it's time to quickly have a look at the glimpses of the 3-day program, very beautifully compiled by our students, Faizali and Umama Fatima. Over to Umama and Faizal.
Thank you, ma'am. So here are the glimpses of the interesting workshop and faculty development program organized jointly by Isabella Thoburn College and Nidm on disaster risk reduction. Here we go.
Thank you, Faiza and Umama, for such a hard work you have put in and for such a wonderful presentation. Thanks a lot. Now, before we proceed further, we are honored by the presence of Dr. E.S. Charles, President, Isabella Thoburn College. I invite you, ma'am, for your concluding remarks.
Thank you, Dr. Singh, for the invitation. And I want to say thank you to the students, the faculty, and of course, the NIDM and all its representatives and every speaker for educating us so beautifully and for planting the seed of inquiry and knowledge in us, which we hope we will get ample opportunity to allow it to grow and bloom. Of course, disaster management, who is not aware of it today? Everybody is talking about it. Even today in the newspaper, I was reading that there is going to be a cyclone. It's happening right now, I think, in Tamil Nadu. I rang up a friend of mine and she said it's raining very badly. So we are right in the middle of it and experiencing the need to do something. Fortunately, they are supposed to be well prepared to deal with the cyclone that is happening. And we hope we'll come out of it without too many problems and not face too much destruction. But these things happen. The only route to handling them is knowledge and early preparedness. As was already said by Dr. Abdesh Kumar, the paradigm shift has already taken place from response to preparedness. Listening to Dr. Abdesh Kumar, the relationship between Isabella Thoburn College and Invertis was brought out. And I'm proud of that relationship. I have been to Claraswin Hospital, and I just wonder whether he knows that the sewage system in the building of Claraswin is very unique and different from any other in this country. I would request him to go and take a look at it, and if he can find it, I have some pictures of it. And maybe we will meet sometime and I would like to go see it myself. I've only read about it and seen pictures. And the journey, yes, the Claraswin Hospital and Isabella Thoburn College, the roots of Isabella Thoburn College started together in 1870 with Miss Thoburn and Claraswin arriving together in Lucknow from the US. One a teacher and the other a doctor. And the land was given by the Nawab of Rampur to build the hospital. So we share a common and a very beautiful history with ethics of service. And both the institutions have been very faithful to the trust bestowed upon them. And disaster management is so strongly related to the essence of service. Without the feeling of involvement and readiness to be part of the saving system, we cannot handle any disaster, whether it is a big one or a small one. There are pandemics, but there are illnesses and ailments that have been there for a very long time, such as smallpox. It killed people and destroyed lives of many people when it was commonly rampant in our country. And it was with great difficulty that it took a man called Dr. Larry Brilliant, who had to actually do dharna in front of UN and WHO to be able to get them to aid India to deal with smallpox. He had come to Rishikesh and Haridwar to seek solace. He was a trained doctor, but when he reached there, he saw every day children, men and women affected by smallpox dying. And there was no way to cure it. There was nothing being done. So he went and wanted to meet the people concerned in a kurta and pajama with chappals and nobody would let him in. So he sat there from morning till evening, and when the building was being closed, they sent for him and wanted to ask him what happened. And when he told them, he got them interested enough to be able to raise funds to bring aid for eradication of smallpox. And that is how the eradication of smallpox started. When I was a young child, everybody had to undergo inoculation for cholera and vaccination for smallpox. This was a must. Fortunately, and we saw many people affected by pox marks on their faces, eyes affected by pox marks. So, but fortunately, this generation has had to deal with it so severely. So this is a success story. So just like this is a success story, any disaster management, if planned and progressed with properly, can be a success story. Only thing, it involves an involvement and sincere ethical discharge of our duties, not only as a group, but as individuals. So that we are not working only as communities or groups, but each of us is preserving what needs to be preserved, what needs to be handled, what needs to be dispensed with individually, so that small things do not grow into big ones. Big calamities never begin, most of the time do not begin as small, as suddenly. They begin as small calamities which happen and then get combined. For example, the forest fire. Without deforestation, probably it would never arrive. But forest fires and flooding and landslides are all given birth to by deforestation due to individual interests of certain people or disorganized work patterns of development. Things like always earthquakes, because we do not take care to do the building rightly and correctly. And as Dr. Panda has pointed out, I have been listening to what he said very, very attentively. He has summarized the entire program so beautifully and very logically and systematically. Thank you, Dr. Panda. You have been able to guide us and help us skim through the entire proceeding. And, it's always easier to retain it in the small head when it's presented the way you have done it. Thank you very much. And all that I can say, that I have learned a lot from this entire program, and I hope we'll get to experience such programs again, and maybe a greater number of our students will participate once the college gets going more fully. And I need to thank the faculty members also for getting together this act. This whole program is so informative and so educative that I'm wondering why we haven't had it before. So, and the students have, of course, like always, added cream to the cake. The presentation and the exercises that they have done, the presentation was really beautiful. Thank you very much. It makes me as a teacher, an old one, feel very, very proud that the young people are doing such a great job. Thank you so much. And I just want to say, have a big heart. Always have the time to give time for a good cause, because no government works alone. A government works with people. Be ready to serve, even if it is a little bit of risk, in places where help is needed. And always give. Give of time, give of money, give of your energy. Energy is the hardest to get, but do give it when it is needed. It may be something very small, like stitching masks and distributing them, but you will be surprised how many people do need masks even today? There are people who cannot afford to stitch their own mask, and they do not have enough to be able to wash them and dry them and wear them the next day. So there are small things one can do. I remember watching my mother stitching socks, knitting, I should say, socks for the soldiers when they were coming back home after the war in 1966. And many of them were injured. And all the women that I remember were all knitting for the soldiers, and they would go to the railway station and hand the socks in through the windows. So community involvement gives strength, and it cannot happen without individual involvement. And this exercise has really awakened the citizenship within me. Thank you for doing so, and I hope it has done it for you also. Thank you very much. God bless all of you.
Thank you, ma'am. Thank you so much for your kind words. We are blessed to have your guidance and support in all our ventures. Thank you, ma'am. Now, I would like to invite Professor Anil Kumar Gupta, Head ECDRM, NIDM, who presented such sublime views in his FDP program and delivered quite an informative session. Sir, we look forward to your insights and perspectives on disaster risk reduction. Over to you, sir.
Thank you, madam. Since I have already spoken in detail and I spoke on the inaugural day also, so I will be very brief. I think this program has been very, very successful, and it had a very wide coverage. So my compliments to the entire team for designing such a nice program. And the success of this program would also depend on how the participants, particularly the participants who are the faculty members, take up this subject and motivate their students. And as I also urge that how we start thinking about developing a disaster management plan for our campus also, and how we share this knowledge with our family members. So these are a few of my thoughts at this valedictory session. And with this, I compliment my colleague, Shri Ashish Pandaji, and all the team from NIDM, Ms. Silky, and all the team from Isabella College, and all the participants from very, very successful endeavor. Thank you very much.
Thank you, sir. Thank you. Your outlook reflects at the depth of the knowledge and experience on disaster management. Thank you so much, sir. Now, I would like to invite Dr. Anima Jamwal to carry forward the program. Over to you, Dr. Jamwal.
Thank you so much, Dr. Tandon. So now, with a lot of pleasure and good wishes, we will be announcing the results for student competitions and e-poster presentation for faculty. There were 3 competitions organized for students during this training program: poetry competition, e-collage competition, and jam competition, or just a minute competition. We will be announcing the results in the same order. For poetry competition, the 3rd prize winner is Miss Shreya Jaiswal. The 2nd prize for poetry competition goes to Miss Uma Yadav. The participant who stands first in this competition is Miss Sheetal Anand. Congratulations, dear participants. Now I would be announcing the prizes for e-collage art competition. There are consolation prizes also for this particular competition. The consolation prize in this competition goes to 2 participants, Miss Archie Gupta and Miss Bhavna Gautam. The 3rd prize is bagged by Miss Nazia Arif. The 2nd prize winner is Ms. Katyayani Joshi. The participant who stands first in this competition is Mr. Vikas Gautam. The participant who stands first in this competition is Mr. Vikas Gautam. Congratulations, all the winners. Now I would be announcing the prizes for JAM competition. The third prize in this competition is shared by 3 participants, Ms. Yamshi Sirat Ali, Ms. Shambhavi Singh Verma, and Ms. Anushka. The second prize in this competition goes to Ms. Anshika. These are the certificates of the 3. Now, the second prize in this competition goes to Ms. Anshika Trivedi. And the participants who bagged the first prize in JAM competition is Ms. Shivangi Gusan. Congratulations. It was a tedious job for the judges because the number of entries were huge. And every participant had put a request Dr. Bhatia to kindly take over for announcement of prizes for e-poster presentation that was organized for faculty and parents. Dr. Bhatia, please.
Thank you so much, Dr. Jamwal. Now I would like to announce the results of the faculty poster presentation. Third prize goes to the poster with the theme Disaster Risk Reduction, a Gender Responsive Approach, presented by Dr. Amita Marwa from the Department of Economics, Isabella Thoburn College. Many, many congratulations, Dr. Marwa. Second prize goes to the poster on the theme Textiles in Disaster Management, presented by Dr. Anima Jamwal from the Department of Home Science. Congratulations, ma'am. First prize goes to the poster with the theme Disaster Resilient Livelihood, presented by Dr. Caroline Beck from the B.Ed department. Congratulations, and the judges really liked your poster, Dr. Beck. I would now like to hand over to Dr. Anima Jamwal.
Thank you so much, Dr. Bhatia. Now I would like to acknowledge the hard work of student volunteers who worked all year round in the Career Counseling Cell of Isabella Thoburn College. We would like to award them their certificates of appreciation on this platform. The student coordinator for the session 2019-20 was Ms. Kavita Samant. Thank you, Ms. Samant, for your hard work. The other student volunteers who deserve a special recognition for their hard work are Miss Arushi, Miss Lovely Upadhyay, Miss Khushbu. Ma'am Samya, may I have the slides, please? Okay, thank you so much. These are the certificates. Miss Tithi Singh, Miss Yashasvi Shukla, and Miss Janvi Bhandari. You can also see here glimpses of some of the activities conducted on the Career Counseling Cell of the college. With this, I would like to request now Dr. Bhatia to take over, please.
Thank you, Dr. Anima. Congratulations to all the volunteers of the Career Counseling and Placement Cell. You have worked hard all round the year for the benefit of the students. I would also like to share that out of the 4 competitions held, paper presentation and jam were judged live. Thus, we got an opportunity to interact with the judges and get their feedback. But e-collage competition and poetry competition were judged offline. We would now like to invite our esteemed judges of these offline competitions for their observations and suggestions. For poetry competition, the judges were Dr. Vinita Prakash and Dr. Stuti Khare. Dr. Vinita Prakash is the principal of Isabella Thoburn College and has been a professor of English for more than 2 decades. I invite Dr. Prakash for her inputs.
Thank you, Dr. Bhatia. It was wonderful reading these poems in both English and Hindi on the theme of disaster risk reduction. And I'm not just talking about the prize winners who need to be congratulated. Nevertheless, all the poems that the participants wrote were very, very evocative. It goes on to show how motivated they were and how involved they had become in the course of these 3 days, and how well they had expressed themselves. Being a student of English literature, I could make out and I could see that their poems were not just about their thoughts and ideas, but also giving a beautiful expression to the ideas and the opinions that they had, particularly on this theme, which is not very easy. So I congratulate not just the prize winners. For me, everyone is a winner. Everyone who participated and who expressed their opinions and their involvement in disaster risk management needs to be congratulated. I loved reading the poems both in English and Hindi. Congratulations to all the participants. Thank you.
Thank you, Dr. Prakash. Now I would like to invite Dr. Stuti Khare, Assistant Professor, Department of English, Isabella Thoburn College. Dr. Stuti Khare, over to you. Dr. Stuti Khare. Ma'am, kindly unmute yourself.
He has unmuted himself, but voice is not coming.
Ma'am, we can't hear you.
The systems is using, the system's voice has to be increased, sound has to be increased.
We proceed further, and if this glitch is over, then we'll have her again on board. The e-collage competition was judged by Mrs. Smita Mathur and Mr. Arvind Bhatia. Mrs. Smita Mathur is a visual artist from Mumbai. I would like to add here that Mrs. Smita Mathur is also our alumna and has been conducting free decoupage workshops for our students, both on campus and offline during lockdown. Over to you, ma'am.
Thank you for having me, Dr. Bhatia. It is indeed
Mrs. Smita Mathur.
Can you hear me?
Yes.
Okay, lovely. Yeah, so thank you so much for having me. It is indeed a pleasure to come back to my college as a judge. The topic, as we know, for the e-collage competition was learnings from COVID-19. And in fact, it is indeed a learning that online platforms such as these can be used for conducting events like this one. And competitions were held online as well as the judging was done remotely. So well done, everybody. The entries that came were high, not only in numbers, but also in caliber. So in fact, we had to request the organizers to allow us to give 2 special mentions as well, because it was becoming very difficult to choose the best entries. So I must say, I must congratulate the participants and the organizers for organizing such a wonderful competition. We judged on the basis, the collages we judged on the basis of visual appeal, context and clarity, effort, creativity and originality. We saw oodles of all of these in the collages that we judged. I just have one small observation to make here, that in some cases, the lessons learned, I want to say that lessons learned are a bit different from the small changes that we have all had to make in our daily lives. So, so taking a small example, like washing hands or sanitizing surfaces or wearing a mask would come under the broader umbrella of maintaining proper hygiene. So this is my only comment that I need to make, but otherwise I had a great time judging the entries and going through all of them. Thank you so much for having me.
Thank you, Mrs. Smita Mathur. Now I invite Mr. Arvind Bhatia, General Manager, ONGC Academy, Dehradun, for his observations and suggestions.
Thank you very much. And thank you, Mrs. Smita Mathur, for giving your comments. Yeah, there were 66 entries. 15 of them we had shortlisted. And we had to give 5 prizes, 3 winners, 2 special mention. And I must congratulate all the participants. Excellent effort by all the participants, I must say, because I've been training people in emergency management. And these people whom I am training are quite experienced people, 30 years of experience. And the students who had participated had put in all the efforts, whatever was visible, whatever they have learned. And the great thing which actually I noticed, the points which they had mentioned was the working from home became a routine thing, accepted way of doing it. Environment, air quality, yes, improved. They noticed it. They mentioned it in their own way in the e-collage. The water quality, the Haridwar one, the hills, mountains being visible, the animal life now, animals enjoying throughout. They had mentioned, most of them had mentioned hills, and then importance of doctors, that we realize how important the doctors are, how important it is that we create more hospitals instead of shopping malls, and the importance of teachers, the policemen who kept on acquiring COVID during this, but the show went on. And then, yes, of course, cleanliness, as Smita mentioned, people realize the importance. It has become a way of life. It was a way of life, more importance to be given after this. And waste disposal, the plastic waste, the medical waste, that also needs to be now addressed. After this, we have realized that during this pandemic, these things become important. Then one thing which actually I wanted and nobody mentioned was the plight of migratory labor. That has not been mentioned. This is one thing actually we now need to address. The entire data of these laborers now need to be mapped with us, where they are from, what skill they have, because they're going to return back to their home now. And we need to re-employ them. And then the corporate social responsibility, before engaging any employee, it becomes the responsibility of the corporate now to take care of them even during the crisis time. It was this thing actually which blasted the scenario, which created a lot of confusion. And then all of us were just noticing it, what is going to happen. And it was nothing, I could not see it myself. So this also now needs to be addressed. A family needs to be together. This everybody realized. People even, they were thinking of staying alone, husband and wife, and they realized, no, joint family is important. All of them came back. Even my, both the children came back. So joint family strengths, people realized, and then need to support each other. Even to your sister, to your brother, whosoever is staying, because they may also be facing problems, COVID-19 infections. And one thing, materialistic versus spiritual, how much you need to be materialistic, whether things are important or not. We are unnecessarily wasting our money and time on things we actually don't need. Dr. Gupta had also addressed this. And then more careful during disasters, overlapping disasters. in series disasters, 3 disasters coming, Amphan, etc. So all these things were covered very nicely. And then digital entertainment evolved. There was people also kept on engaging themselves. And in the end, my takeaway from this is I'm very happy. I mean, it was a lot of learning for me also. And being engaged in disaster management training and also having association with NIDM now since last 3 months, I can only say that I present myself as a resource person. If I'm required, I'll request the management of IT College now that we can all come together and start a small training center for people in Lucknow, especially the students and the faculty, and start doing the drills as to what exactly happens during this crisis. What are the special rules of this thing? Preparing an emergency response plan. I know about my ONGC emergency response plan, which I've been making, which we have been discussing. So there will be emergency response plans for various schools and colleges also. We can take help of NIDM. We can take help from one of the premier schools and colleges all over India. A lot of faculty is now here. And then we can organize one such model emergency response plan. And then other colleges in Lucknow and other places also can follow it. So that is my suggestion. Because after this, it is the next step, we have to do it. Thank you very much. Thank you all. Thank you very much.
Thank you, dear judges. I'm sure participants have received many insights from your sharing. Ma'am Stuti Khare, can you come? Ma'am Stuti Khare. Let's see if we can hear you.
No, not yet.
Unfortunately, I think the system is not working. All right. So we proceed further with the program. I hope our participants enjoyed this 3-day learning experience as much as we enjoyed bringing it to you. I would now like to invite Dr. Souvik Mukherjee. He is a faculty at St. Xavier's, Calcutta, and for successful completion of the faculty development program, he presented a poster on the theme Extreme Storms and Disaster Preparedness. I would like him to present his views on how did he like this FDP.
Ma'am, good evening. Can you hear me?
Yes, I can hear you.
Good evening. Thank you so much for giving me an opportunity to participate. I would like to thank the entire organizing team at Isabella Thoburn College, NIDM, for arranging the workshop such beautifully. Whatever I expected, I think it exceeded my expectation, and whatever I'm taking away from this workshop will definitely, or rather I should not say will, it has definitely widened my outlook with regards to disaster preparedness and kind of management. I'm eagerly waiting forward to being a part of future workshops, and I would like to take a special mention or special note of what Dr. Panda, Dr. Gupta was presenting, specifically what Dr. Panda said, and with regards to disaster. But summing up, I think I just take a leaf out of Dr. Gupta's thing that he was presenting today. Known unknowns, unknown unknowns. So I think we should be ready for more such unknown unknowns that crop up in the near future. Thank you so much.
Thank you, Dr. Mukherjee. We are so happy to know that you found this FDP useful. Now I invite Dr. Anupma Shrivastava, Head Department of Economics, Isabella Thoburn College, Lucknow. She presented a poster on the theme, Mainstreaming Disaster Risk Reduction in Development Activities. Dr. Anupma Shrivastava, the stage is yours.
Am I audible now?
Yes, you are, ma'am.
Okay. So the events that cause extensive harm called disasters call for the urgent need for emergency management. The discipline and profession of applying science, technology, planning management, and also innovative practices and collaborations involving government agencies, multi-level organizations, and academic institutions to find out certain ways to deal with extreme disasters that can injure or kill people, do extensive damage to property, and disrupt community life. So a very good evening to each and everyone present here. As I have been asked as a faculty from the Isabella Thoburn College to share my feedback, I would like to thank firstly Professor Gupta, Head ECDRM NIDM, and Mr. Panda, also from NIDM, our President and Principal Ma'am, and the whole organizing committee, including Chair Coordinator Dr. Sonika Bhatia, for organizing this 3-day FDP cum training workshop for all the stakeholders on such a relevant topic of disaster risk reduction and management. The workshop included 9 technical sessions covering a variety of topics, both objective and subjective, ranging from basics of disaster management to mega hazards of disaster management operations to forest fires. The workshop also gave an insight into emotional intelligence, psychosocial care, and capacity building and its relevance in handling disasters. The program even became more interesting by including student competition and also e-poster competition by the faculty. So in all, it facilitated a two-way dialogue between the trainers and trainees, including students, parents, and faculty. Overall, this FDP has been able to foster knowledge and professional skills of faculty and academic performance of learners. So a big thank you and congratulations to you all. Thank you.
Thank you, Dr. Srivastava, for your extensive coverage. I now like to invite the most important stakeholders of this workshop, our students. Ms. Diksha Ishani, a student of economics, MA second year. Over to you, Diksha.
Thank you, ma'am. A very warm good evening to respected dignitaries and to each and every person present here. I, Diksha Mishra, a student of MA Economics, Isabella Thoburn College, Lucknow, would like to share my views regarding FDP cum training workshop on disaster risk reduction. I found this workshop really helpful. One of the most enjoyable and informative workshops I have ever attended. We as a student are always thankful to our respected President ma'am, Principal ma'am, all dignitaries of National Institute Disaster Management and faculty members for organizing this amazing, interesting and inspiring workshop. I really enjoyed this 3-day workshop in participating and attending different activities like e-collage competition, jam session, poetry competition, as well as e-poster presentation for faculty members. In this workshop, I have gathered information, tools, and instruments that increased my awareness and understanding of disaster risk management in general and the topics of risk reduction, transfer, and financing in particular. The content was relevant and very well presented by all eminent guest speakers. Now I feel like I can apply this knowledge in real life whenever I get the chance in future. I feel more confident to do something for disaster risk reduction. And the most important thing I have learned through this workshop in the future, being a teaching enthusiast, my prior job will be to make people aware and to guide students new methodologies in tackling such situations first and foremost. Thank you, ma'am. Thank you.
Thank you, Diksha. Next, we have Miss Yamsha Ali, a student of BCom 3rd year. She participated in JAM. Over to you, Yamsha.
Good evening, everyone. I must say, this is the most informative event I have ever attended. I feel fortunate to be a part of this event. The presentations by knowledge holders and resilience practitioners drew the audience in and held their attention for long hours. After listening to the speakers, I am able to reimagine the way I think about the disasters our country faces. It is worth praising that how simply the speakers has made us realize that how much it is important to trust our neighbors, to have faith on our family members, and how differently different people are affected by disasters. The participation of teachers and students lightens up the event. Thank you, speakers, for informing and encouraging us to create our own resilience. I am very grateful to the organizers for hosting this amazing event. Thank you once again to each and every member for making this event successful.
Thank you, Yamsha. Next, I would like to call upon Ms. Faiza Ali, a student of MSc Chemistry second year. She participated in the e-collage competition and also compiled the kaleidoscope of events which was put in front of you. Over to you, Faiza.
Thank you, ma'am. Good evening, everyone. I deem it a great privilege and honor in being a part of this interesting workshop on disaster risk reduction. First and foremost, I would like to thank all our esteemed speakers for showering us with their words of wisdom and knowledge. There was so much to learn, from learning the concepts of disaster management and seeing its impact on biodiversity, to learning the concepts of disaster management in oil and gas operations. Really fascinated us. Also, from writing deals added reaction mechanism in our notebooks to really seeing the working of it in the self-polymerization of styrene really fascinated all of us. So I would like to thank all the organizers for bringing up this amazing activity concerning this as a major and important issue. These 3 days were indeed full of knowledge and enlightenment. Thank you so much, ma'am.
Thank you, Faiza. Thank you, dear students. Hope each one of you has some takeaway from this workshop. Now, I would like to invite our principal, Dr. Vinita Prakash, for proposing the vote of thanks.
Thank you, Dr. Bhatia. Am I audible?
Yes, ma'am, you are.
Okay, thank you. So like all good things, this must also come to an end. And I'm sure that there has been a lot to take away from this 3-day training workshop come FDP on disaster risk reduction. It has been a very informative, interactive, invigorative, and insightful 3 days. Not only did we learn about the warnings and magnitude of the disasters that come upon us and take us unawares, but we were also sensitized about the basics, the mechanisms, the challenges, and the issues related to disaster management. I'm grateful to Major General Manoj Bindal, the Executive Director of NIDM, and Dr. Mrs. C.S. Charles, the President of Isabella Thoburn College, for having felicitated this program. The collaboration between NIDM and Isabella Thoburn College, I'm sure, will lead us to further joint efforts for disaster management training programs and capacity building in the future. And developing a disaster management for the campus, as Mr. Panda said, is something that I'm really looking forward to. And I'm sure that in days to come, this will happen when we work together. In the last 3 days, we've had 9 technical sessions by experts in their fields on the issues and impact of various disasters like chemical disasters, forest fires, oil spills, floods, earthquakes, and of course, the mother of all disasters, the global pandemic, COVID-19, which has led to a new normal. And this new normal comes with its own issues and own challenges. I'm grateful to the NIDM faculty, Professor Anil Gupta, Mr. Ashish Panda, and Ms. Shilki for their very expository sessions, throwing light on all aspects of disaster risk management. I'm also grateful to Mr. Arvind Bhatia, Mr. V.K. Dhawan, Dr. Sanjay Singh, Mr. Avdesh Kumar, and Dr. Sonika Bhatia for highlighting also the other side of disaster risk management, like the case studies, the psychosocial care, the community capacity building, the impact on educational institutions and different organizations, and also the way forward. Where do we go from here? I'm grateful to each one of you for making the sessions interesting and relevant. I would especially like to congratulate the students who participated in the poetry writing, e-collage competition, the poster presentations, and the jam sessions. All of them came up with very apt and lucid expressions of the disaster risk reduction. It shows that they were truly motivated and involved in what they were hearing from different experts. I also congratulate the faculty from various institutions who presented papers on disaster risk management. The content of the papers and the posters go on to reveal the purpose of holding this conference and workshop has been accomplished. I congratulate all of you, not just the prize winners, but the participants as well. This is, however, not the end, but the beginning of a new journey of stakeholders trained to train others and the way forward towards a disaster resilient future. No event can be successful without the active and enthusiastic participation of the participants. I'm grateful to each and every participant from Isabella Thoburn College, from different institutions and organizations across the country, both faculty and students who because of your participation, we are greatly encouraged, and your response has encouraged us to go further and to have more programs and for making this workshop worthwhile. I also must express my heartfelt gratitude to the organizing committee of Isabella Thoburn College, who worked very hard over many days to make this program a success. It was wonderful to see the coordination and the harmony with which they worked, each supporting and encouraging the other. Thank you so much, Dr. Sonika Bhatia and Dr. Anupma Srivastav, Dr. Lawrence, Dr. Neetu Sharma, Dr. Umang Tandon, Dr. A. Jamwal, Dr. S. Rajan, Mrs. Moses, Ms. Devina, Ms. Samia Farooq, Dr. Imran, Dr. Saman Raza, Ms. Jane Dan, Dr. Stuti Khare, Dr. Shweta Agarwal, Ms. Sukanksha. I'm sorry if I've missed out on any of the names, but I'm truly grateful to Dr. Sonika Bhatia and the entire team for all the hard work that cannot be seen, but working behind the scenes for so many days and to make this program happen. Thank you, Professor Gupta. Thank you, Mr. Panda. Thank you, Ms. Shilki, for being with us each step of the way. And thank you, NIDM. We enjoyed this journey together and look forward to future collaborations and endeavors with you. Thank you so much for making this program a success. And I wish you all the very best for whatever you have learned. Now is the time to put it into practice. Just as we began this workshop by thanking our Lord God Almighty in a word of prayer, let us also close this program with a word of prayer, thanking God for being with us throughout this. Let us close our eyes and look to God in prayer. Lord God Almighty, creator of heaven and earth, we come before your throne of grace with praise and thanksgiving. We thank you, Lord, that you have kept us safe and healthy, even in this time of pandemic. We thank you, Lord, that you have given us resources to protect ourselves, even as we pray for those who are not so fortunate. We pray for the families of those who have lost their lives and livelihood. We pray for those who are suffering and are in hospital. And we pray, Lord, that you will take care of them and provide all their needs. We thank you for this 3-day workshop where you helped us to learn how to manage disasters, how to work towards a plan to make a disaster resilient future. We thank you for all the experts that are present here. We thank you for the views that they expressed so lucidly and for educating us, for training us, and for giving us valuable insights. We thank you for all the stakeholders who are present here on this platform. We pray for your blessings upon each one of them. Strengthen the work of their hands and take them from strength to strength to be a blessing to our community, to our country, and to the world at large. And we pray, Lord, that we will know the way to go forward and we will work together in harmony to make a future that is good for your creation, to live in. We commit ourselves into your hands and ask this prayer in the name of our Lord and Savior, Jesus Christ. Amen. Thank you, Dr. Bhatia, and thank you all the participants. Thank you, NIDM, once again. All the very best for our future endeavors, to which I'm looking forward to. Thank you.
Thank you, Dr. Prakash. The link will be on for the next 15 minutes. So those of you who have not been able to fill the feedback form can do so. Otherwise, we have culminated the workshop now.